senior partners like Peter Sands from the Global Fund, Lucy Kaditu from Stop TB Partnership, Sherry Vincent, USAID, Benjamin from Africa, CDC, Andre from WHO Afro. And during the opening remarks, Carol introduced ACT, its vision, the mission. She highlighted the achievements of ACT over the years. Very importantly, Lucika, in her opening remarks, emphasized on the need for CSOs to demand that there is no interruption in TB services, thereby ensuring that funds are not diverted from TB to COVID. Peter Sands congratulated the region for the success of the meeting and highlighted that we are not on track even before COVID, and we do not seem to have found our way. He encouraged us, he encouraged participants, and mentioned that it is time for the global community to come together more than ever to fight against TB. The first session was centered on the TB epidemics in sub-Saharan Africa, in the midst of COVID-19 pandemic. The session was graced by amazing experts like Dr. Andre Afro, WHO, who gave participants a very, very robust information on the epidemiological data of TB epidemic in Africa and the progresses on the TB and COVID-19 pandemic. Dr. Eluid from the Global Fund gave us a deep insight into the Global Fund budget, stating that the quality of the request for TB has improved, and he reiterated on the Global Fund's commitment towards working with relevant stakeholders towards achieving the UN HLM targets. He also highlighted that the Global Fund have increased the TB budget by 20% to accelerate progresses towards finding missing cases. Sahu from Stop TB Partnership Geneva, during his presentation, mentioned the progresses made so far towards achieving the UNHLM targets, made recommendations on the objectives, on how the objectives can be met. He highlighted the impact of the COVID-19 pandemic on TB, especially on case notification through the Stop TB modelization study and the survey conducted by TB communities on the impact of COVID-19 on the TB epidemic. His presentation revealed the unprecedented deaths amongst TB patients, which clearly showed that more people died from TB than COVID-19. This session it was chaired by Carol. The second session was chaired by Alan Maleche and was centered on the progresses towards achieving the Stop TB Global Fund strategy on CRG. The session had panelists who made presentations on the key progresses on the UNHLM targets. We had Vema from SAMA, who shared experiences as to how African miners, in the light of the impact of the pandemic on African miners, and also he mentioned that their capacities were being built. He also stated that more advocacy needed to be done, highlighting that stigma associated with TB and COVID is still on the rise, and that TB is a human rights issue. Consequently, the need for scale-up of CSO's empowerment to ensure social protection and also that missing cases be found. Tandy Katolo from Stop TB Partnership Geneva, in her presentation, presented on the CRG tools and technical assistance that Stop TB partnership provides for CSOs, stating the CRG assessment tool will help to provide answers on who is stigmatized. The stigma assessment tool will provide will help to measure the level of stigma, and the investment package will provide a comprehensive guide and a costed plan on how to implement such projects. She mentioned the next steps for the project and also highlighted that the CFCS round 10 will be announced towards the end of the year. Sherry from USAID presented on the USAID Global Accelerator and Accelerator to End TB, stating its objectives and its focus. She mentioned that the approach is not business as usual. And during her presentation, she acknowledged the fact that COVID-19 has impacted on health systems, it has impacted on patient care, TB staffing, as well as funding for TB. She emphasized on the vital role of CSOs in TB response and mentioned that USAID is making more shifts to support the efforts of CSOs. Kate Thompson from the Global Fund, during her presentation, gave participants insights into the strategic objectives, the main activities, and the achievements from 2017 to 2019. And then she also acknowledged that the progresses made are due to partnerships with both CSOs at the grassroots level. The third session was centered on the CFCS project, during which implementers from the regional and the national level shared key successes, best practices, and challenges faced during the CFCS implementation, through sharing their action plans and the way forward. From all the presentations, participants were able to gather good practices on how to effectively engage the CRG assessment. This session was chaired by Olive Mumba. The fourth session was centered on the priorities, including the UNHLM targets. The panel discussion had Rosemary Mburu from Waki Health, Theophile from Stop TB, Stop Global TB, and Ivan from the Union African region. From the panel discussion, panelists discussed the progress made. That despite the fact that we are still far from achieving targets, progresses have been made by some countries and efforts are still in place. However, they highlighted a great need to push for stronger coordination, cooperation between CSOs at the regional and at the national level. They highlighted that CSOs need to see themselves as key partners towards achieving universal health coverage, and a strengthened collaboration between CSOs and parliamentarians should be prioritized in order to accelerate efforts towards achieving the UNHLM targets. But panelists also noted that one of the key priorities to ensure that the goals, the gains being made in TB, malaria, and HIV are not lost in the context of the COVID-19 pandemic. It was also highlighted that the TB space, partners in the TB space are not in competition with each other, rather in competition against TB. The final session was centered on making TB CRG assessments to scale in Africa, highlighting the key successes, the challenges, and recommendations from TB assessment, including TB assessment, TB stigma assessment, research presentation from Global Fund, Alan Malaysia, Maxim Lunga, PRC, and Deb from Ghana. The session was chaired by Chief Austin Obefuna, and the meeting was also held by Chief Austin, who thanked participants and panelists for their time and for dedication in the fight against TB in the African. Some important information that was passed is the fact that information notes will be released on the Global Fund website first week of November. Also, the Global Fund will also share COVID catch-up plan response. Also, the Union Africa region is being rescheduled to next 2021 due to COVID-19. And like I mentioned earlier, the CFCS round 10 will be open at the end of 2020. Thank you. Thank you, Olaide.
Hello, thank you very much, Deborah. That was very detailed. I will not attempt to summarize what you have said, but just suffice to say that yesterday was very informative. We all learned a lot. There was a lot of new information passed, and I believe that the slides for the sessions are going to be shared in the course of the meeting. So thank you very much, Deborah. We really appreciate that. So very quickly, moving ahead because of our time, we're going to move into the next session for today, the very first session, that is session 6, which is looking ahead to the 2021-2023 regional TB response on CRG. We have a lineup of speakers who are going to take us through a couple of policy documents, as well as give us a sense of what's the thinking as we go into the years ahead. What is the thinking in reaching the HLM targets and ending TB? So I'm going to invite our first speaker, Dr. Enos Masini from Stop TB Partnership. I believe he's on standby. Yes. Okay. So, yep. Okay. So over to you, Dr. Enos. You have 10 minutes. And then Roderick, please, can you share his slides? Thank you. Over to you.
Thank you. I did not really make slides when I saw it's a panel discussion, and I'll therefore have some talking points. And thank you for the invitation to this meeting. And as introduced, my name is Enos Masini. I work at both the Stop TB Partnership as the regional advisor for Africa, but I also work at the Global Fund TB team as a senior TB advisor supporting high impact Africa countries. First, I think I will speak about just generally high level about the global plan. And then in addition, I think there's an issue you raised about looking ahead to 2021, 2023. What does it mean? Especially how do we get up and be able to achieve the targets that are set before us? And then also in terms of the upcoming Global Fund strategy, what are the issues that probably as a constituency would be important for you to be able to look at going to this work? First is that, let me first of all state that I've closely worked with TB civil society, TB NGOs, TB advocates, TB champions in my previous work and in my current job. Previously, I used to work as the National TB Program Manager for Kenya, and I worked with great colleagues that I see even participating in this forum, like Stephen Anguva. I worked with Evelyn Kibuchi and the rest, and they provided very invaluable contribution in shaping the TB response in the country and in assisting us. I'll give you an example. In 2015, the country was having a precarious situation with TB drugs. And being the National TB Program Manager, there's just as much noise you can make in the ministry without ruffling too much feathers. So we tasked these colleagues And they actually went to the Parliamentary Health Committee and they managed to secure resources for domestic funding for TB drugs. From then on, I think Kenya, as you may know, all the first-line TB drugs are bought by government, and it's courtesy of such colleagues like Evelyn and Stephen who are here and the rest who did this job, just showing what role we can all play. But going back to the global plan, I think I would want to say that in view of the UN high-level meeting targets, which I think Debra or the colleague who was giving a summary provided, based on the UN HLM targets that came in 2018, this was updated so that the global plan can focus on what we call being able to achieve these UN high-level targets, which you have all, I think, are aware of and which was spoken about yesterday. And in order to reach these 40 million people for TB treatment, 30 million people for TB prevention treatment, it became important that this plan is updated to be able to accelerate TB care and prevention, to be able to ensure that there is a strong political will at the country level to achieve these targets. And that's why there's a great deal of involvement of not only the highest levels of the ministries or the political leadership in the countries, but also colleagues like you who can directly talk to them, but also ensuring a rights-based, people-centered approach, which I think it's really another big focus for this meeting. And I think as the summary was being given, colleagues like Tandy spoke greatly about them yesterday. In terms of another thing that it gives a very big focus on is new tools, bringing new tools to countries, ensuring that we use tools. I think there's colleagues who have their microphone not muted. Okay, thank you. Ensuring the new tools like use of rapid molecular tests
l'utilisation des tests rapides
are broad. But what does this mean in view, of the Global TB Report 2019?
Alors, pour ce qui est du rapport
which, as you heard yesterday and from the colleagues who spoke yesterday,
les collègues d'hier, ceux qui ont parlé hier,
both in Africa and globally, we are not on target in achieving
en Afrique globalement, nous ne sommes pas dans les tracks pour ce qui est
in terms of reducing new infections,
d'atteindre notre objectif dans la réduction de nouveaux cas d'infection,
reducing new deaths,
réduire de nouvelles morts, de cas de décès,
and of course reducing the huge costs that patients face as they seek care.
Et puis réduire les.
But this inability to achieve these targets has just been made worse by the COVID pandemic. So when we are looking forward to 2021, 2023, it's very important to look at these two contexts. That one is that even in 2018, in 2019, before the pandemic, we had not globally and in Africa, we were not on course on achieving the targets that we set. Probably the only target that is on course on being achieved is for people living with HIV and putting on TB prevention therapy, but the rest are not. But now the COVID pandemic has happened, and it has put an additional reset on the TB progress. So how one does countries respond, and what role can you be able to play in this? One, I think at the country level, there's an urgency that in all our countries, restoration and acceleration of diagnosis, treatment, and prevention is imperative. That the losses that have happened during the COVID times must be reversed. And this will be through acceleration of the treatment and prevention. And I'm sure you've talked about this, to be able to achieve the same ambitious targets. But second, it will also mean that we need to adapt the TB models to the context of COVID-19. And I think you all know these will require, for example, identify opportunities where TB can benefit from COVID, but also decentralizing care to the lowest level of the community, taking the care that would have been probably held in a health facility and taking it closer to the community. And this is a role that yourselves are very adept at playing. That would be my view on that briefly. But also going in 2021, 2023, we are going into the new global fund, development of the new global fund strategy. Probably just my pointers on some of the things that as you make contribution to this strategy, you need to look at. One is that, of course, in Africa, there's been a lot of progress on the impact of the GF investments. There have been substantial reductions in incidence and in mortality, and I'm sure Andre from WHO Afro offered these insights yesterday. But there still remain significant gaps in scale up of interventions that will ensure that we achieve, say, prevention of
Dr. Mancini, you have 2 more minutes, please. Thank you.
To ensure that we achieve prevention, say for childhood TB contacts, and areas of quality care that can be provided at the community, e.g. treatment success rate. In many countries, in several countries, the treatment success rate is still low. And there are multiple factors that hinder this, in which you can contribute to the strategy about health system weakness at the community level, resource needs, especially domestic resource needs. There are human rights and gender-specific barriers. These, in my view, are areas that you can be able to continue to contribute to and ensure that the strategy is able to cover this area. I think that would be my contribution as of now. But lastly, just to say, I've seen significant progress, say, in the countries that I directly support, made in human rights and gender and addressing those human rights and gender in high-burden African countries. But there's still a lot that really requires to be done in addressing this. So I think in making your case in the Global Fund upcoming strategy, it would be important to see how this area can be further strengthened and more investments put in it to be scaled up. Thank you very much for inviting me. Over.
Thank you so much, Dr. Mancini, and thank you for keeping to time. I think that your presentation was quite illuminating. You highlighted the need for us to identify that there's still a whole lot more to be done as we look forward to 2021, 2023. And, you know, there are examples about the roles that civil society can play in adapting the models of care, differentiating care, ensuring that we focus on community, human rights, and gender, particularly in the new Global Fund strategy. Thank you so much for those pointers and for highlighting those issues. I'm sure there might be questions for you, but we may not have enough time for questions. So please would appreciate if you look into the chat box. If people are sending questions to you, you might be able to directly answer through the chat box. Thank you very much for your time. Now, very quickly, I'm going to invite the next speaker from the Global Fund. I see on the agenda, we had Jack. So it seems that it's Jack McAllister from the Senior Technical Coordinator for Policy and Strategy in the CRG Department of the Global Fund, who will be representing and speaking on behalf of the Global Fund. So Jack, over to you. You have 10 minutes.
Good morning, everyone. Thank you for inviting me to attend today. It's a pleasure to see so many familiar names on the list. I can keep it actually quite short because I know we're pressed for time and it'd be great to allow some time for questions. But I'm I'm here really just to give an overview of what the opportunities are for engaging in the next Global Fund strategy development process will be over the next few months. And, from what I've gathered, the development of the strategy has already been a big part of what's been discussed at this meeting so far. So I just wanted to speak to some of the specific opportunities that are coming up for engaging and influencing the next strategy. And I think, as an aside, I think it'll be really important for this community to take advantage of as many of those opportunities as possible, because I think what's clear is that a really strong TV-focused voice is going to be necessary to really move us in the direction we need to go after 2022, which is when the new strategy will actually kick in. So I just want to put that little note in first. But so the the next Global Fund strategy will cover a yet to be determined period after 2022, which is when the current strategy expires. So in terms of where we're looking, we really are looking towards, that final push towards 2030 and achieving the 2030 goals. But the process for developing the strategy is, quite a long one, and involves this initial phase that we're in now of really getting as much input as we possibly can from stakeholders across the Global Fund Partnership, and very importantly, communities and civil society, which is really what I've been focusing on for the last few months. Just to almost work backwards a little bit, the strategy will ultimately be approved by the Global Fund Board at the end of next year, 2021. So there's usually a board meeting in November of every year. The final strategy will be approved at next year's November board meeting. But between now and then, there's a flurry of activity to really get us to the point of having a robust strategy for the board to approve. I think since May, there's been an open consultation period that has been ongoing, and it's really an opportunity for everyone and anyone to contribute their input and their views on really what direction they think the response to the 3 diseases needs to be moving in, and what their and their community's priorities are. What do they think the Global Fund is doing well? What do they think the Global Fund needs to do better on? And what areas is the Global Fund currently not particularly active in that they would like to see the Global Fund do more work in? So those kinds of questions are really where we are in the process right now. And there's I think the most broad opportunity for folks to engage is to go to the Global Fund website, and on the strategy page we have a couple of options for folks to provide their input and their views on really these big questions about what direction the Global Fund needs to be going in, and that includes engaging by participating in a survey that we've constructed, as well as directly submitting input through a special email address. And all this stuff, it feels like it kind of, these things can often feel like they go into a void. Trust me, they all go to actual people who are reading everything and digesting it and compiling the feedback to really get an understanding of where the broad partnership is, and make sure that we're actually reaching and hearing the voices of the full diversity of stakeholders that make up that partnership. So I really encourage all of you who haven't to first, participate in that open consultation period. And again, you can do it as an individual on your own behalf, but you can also do it as an organization or a full constituency of folks to submit a collective view or a collective opinion if you're part of an organization that wants to develop a statement in response to their views on what direction the Global Fund should be moving in. That's a perfectly acceptable way to participate and feed into that open consultation period. So in terms of timeline, we're accepting submissions for that open consultation until the end of this year. So basically until you have, until now and the holidays to submit, whatever input, broad input and feedback you'd like to. And that, all of that again is going to go to inform, ultimately what becomes the framework for the final strategy that will be approved next year. So I really do encourage all of you to take advantage of that opportunity. We've provided a number of materials to help, keep folks sort of informed on the process as it's moved along, as well as give background onto some of the, specific areas of interest, including the disease responses, what the Global Fund's been doing, how well it's been doing. All of those materials are available on the Global Fund Strategy webpage. And included in that, we've created a number of PowerPoints and a number of other documents that have been specifically designed to be of use to those groups that want to host their own consultations. This is another way of engaging that we've really been encouraging people to do that, through calls like this and others. We really want folks to, feel that they have the freedom and the ability to host their own discussions about the topics that are most important to them. And to convene the voices that they think need to be part of the process, and to provide us with the outcomes of those discussions and consultations. That's a key part of the strategy process, and we really encourage a number of groups that I see represented here today have been doing that, and I think that's great. And I know others are planned in the next few months, so that's another way to engage. And we've developed and provided a number of materials to help facilitate those conversations, and those are free for people to use as they will. You can edit and remove slides and use whatever is relevant to help spur and inform discussions with your constituencies. I think there are a number of other opportunities coming up between now and January. We are working with the CRG regional platforms to have a number of consultations. We're also working, what we've noticed that so far in the open consultation period, there hasn't been a lot of youth engagement. So we're working with a number of groups in the Global Fund Youth Council to really ensure that the Global Fund strategy, the next Global Fund strategy, has a robust youth voice represented. So we're working with some groups to make sure that consultations happen that are being led by youth representing all three diseases, which is, in the past, I think, been a challenge, and one of the areas where the Global Fund has not been particularly strong, and we're trying to rectify that in this current process. In addition to the open consultation period and this open space to work with organizations and groups to do their own consultations and then take the outcomes of those consultations and make sure that they go directly into the process of informing the next strategy. The really big event coming up are the partnership forums that will take place in the first quarter of next year. I think a particular interest for this group, the Africa Partnership Forum, will take place on the 17th, 18th, and 19th of February. The Global Fund Strategy Committee has approved those dates, and it's also approved the move from what we've done in the past, which is having the partnership forums in a particular country in a physical space, to making the partnership forums in a virtual format. That very clearly, I think it was the consensus of the partnership in general that we're just not in a place with COVID-19 to feel that we can safely have partnership forums in person, so they will be run virtually. In terms of engagement,
you have 2 more minutes.
That's fine. This is the last thing anyway. In terms of actually engaging with the partnership forums, we're currently soliciting nominations for folks across the partnership to either throw their own name into the running and to nominate themselves to attend the partnership forums or their region's partnership forum, or you can nominate somebody else that you feel would be a really strong candidate to attend the partnership forums. And I really want to encourage this group to take advantage of that opportunity to either, again, nominate yourselves or nominate others, but also to make sure that that opportunity is known by as many people as possible. The deadline for submitting nominations is November 6th, so it's actually coming up quite quickly. But I think, there are, we've, made sure that a proportion of each partnership forum is dedicated to community and civil society participants. So we're working to guarantee that there's robust community and civil society participation in the forums. But we really want to encourage as many people to nominate themselves or others as possible, particularly from the TB community. That again, that's an area where we really want to see robust representation. So I can share with this group the nomination forms and the details. It's not terribly extensive to nominate someone, but it's a really important part of the process. And then in the coming months, when it's known who will ultimately be attending the forums, we'll be working to help capacitate those folks and make sure they're prepared and are stepping into the partnership forums feeling that they can represent the views of their communities successfully and powerfully. So those are the opportunities I just really wanted to articulate today and let you know that we are seeking nominations for people to attend the forums and that the Africa Forum will be taking place from February 17th through 19th. So, and that we are still accepting any and all input in the open consultation period. The link for engaging in that is on the Global Fund website. So those are all the opportunities I want to make all of you aware of and to really, again, encourage as much engagement from TB focus groups as possible. So yeah, I won't go over time anymore, but thank you for allowing me to speak today, and I hope that was helpful.
Thank you very much, Jack. That was indeed very helpful. Thank you for highlighting the various opportunities that are available that civil society within the TB space can leverage on. There's the open consultations. There's the website where we can feed into the strategy page. There's the background materials that can be reviewed. There are consultations that civil society can organize. And then, of course, there are the CRG supported consultations that are coming up in the months ahead through the Youth Council and other platforms. And then there's a partnership forum. Thank you very much for highlighting all of those opportunities. There's a question for you in the chat group. Somebody is asking for the link to the partnership forum form. So if you could please share that link in the chat box, that will be very helpful. Thank you once again, Jack. Now we're going to move on to our next speaker from WHO. I'm going to invite Paul Kwagaisha. I'm sorry, I hope I pronounced that very well, or Kamungasha. Sorry, Paul Kamungasha. Over to you. You have 10 minutes. Thank you. Hello, Paul. Okay.
Good morning, good afternoon, good evening, depending on your time zone. I'm Roger Paul Kamungasha, as you've been told. I'm a member of the WHO Global Civil Society Task Force. I'm grateful to be part of this, and I would like to congratulate ACT before I start. I think I was part of the inauguration of ACT in Washington, DC, when it was formed. So I'm very grateful that ACT has taken a leap, this great leap in form of building collaboration, which I hope is good for TB. This is the first slide, Africa Regional Meeting on achieving the Africa TB UNHM targets by enhancing CSO community engagement in the region. Next, am I supposed to turn? The next slide, please. Yeah, I would like to talk about the WHO Global Civil Society Task Force. In a bid to partner with civil society, WHO introduced this revamped task force, a 15-member task force to strengthen collaboration for accelerating progress towards MTB in 2018. The task force is a culmination of the communities made by WHO's Director General to strengthen civil society engagement. The reason why. Next slide. Those are the 15-member team of the task force. Next. The task force has priorities. Among the priorities in this presentation, I'm sticking to only priority number 1, the political declaration of the UNHCR implemented effectively at country level. That was our priority number 1 that I have to share in this meeting. All components addressed barriers to access, diagnosis and treatment, pharmacovigilance, monitoring for side effects, finding missing people, which is key, addressing stigma and discrimination, meaningful engagement of the affected community and CSO, which is our catch right now, roadmap and a mechanism to measure progress. These are priorities for the CST. Next. Priorities for the civil society task force. Then the task force has roles they've been working on and ongoing. Advocate for WHO to provide guidance to countries for this effective implementation. Recommend to WHO to develop tools that will provide guidance to the countries to incorporate the commitments into national plans and monitor the future progress, and involving the task force members accordingly to help in developing the tools, which has been going on, still going on. Recommend to WHO to instruct WHO global, regional, and country offices to support in ensuring community and CSO participation, once again, in the implementation and monitoring of global, regional, national level targets. Next. All this is intertwined in the UNHRM TB key targets. Here I'm picking out targets 9 and 10. 9 is about to request the DG of the WHO to continue to develop the multi-sector accountability framework and ensure its timely implementation not less than 2019. This work has been done so well, effectively, and though it's still ongoing, given the COVID situations, but it's still going on. Then 10, the target 10 is further request the Secretary General, with the support of the WHO, to provide a progress report in 2020 on global and national progress across sectors and accelerating efforts to achieve agreed TB goals, which will serve to inform preparations for a comprehensive review by heads of state and government at higher level meeting in 2023. Next. Here it's a bit stuffed. UNHM, the TB key commitments. These are priority commitments. And this meeting I want to highlight those that are CRG related. Transform the TB response to be equitable, right-based, and people-centered. You'll see I picked out in the UN political declaration, there's page 18, page 33, page 37, as we go through page 38, we don't have time, but recognize the various social barriers, TB, prevention, diagnosis, and treatment services, especially for those who are vulnerable or in vulnerable situations. And they need to develop integrated, people-centered, community-based, and gender-responsive services based on human rights. 33 is commit to developing community-based health services through approaches that protect and promote equity, ethics, gender equality, human rights in addressing TB. Commit to promote and support an end to stigma and for all forms of discrimination, including removing discriminatory laws, policies, and programs against people with TB. Then 38, it's to commit to providing special attention to the poor, those who are vulnerable, including infants, young children, and adults, as well as elderly people and communities, especially at risk of and affected by TB in civil society and affected communities. In the planning, get meaningful engagement of civil society and affected communities in the planning, implementation, monitoring, and evaluation of the tuberculosis response. Next. Next slide. Then I would like to end with the progress made so far on the civil society task force role. The task force has worked with respective countries worldwide to ensure uptake of the UNHCR targets and commitments, and it's still ongoing. Political commitment by heads of state has been achieved in several countries and still ongoing. There's visible engagement towards the multi-sector accountability framework across all countries, leaving no one behind, because we believe in order to achieve universal health coverage, we should not leave no one behind. And as community and civil society, we're saying nothing for us without us. There's also ongoing meaningful engagement of civil society and affected communities in global fund mechanisms at all levels. It's going on in every country. Next. Progress still goes on, continues. The task force provided input into the United Nations Secretary General Progress Report. So done effectively. All WHO regional chapters are working closely with the task force. The task force has been part of the WHO TB program reviews in several countries, and we are participating from the perspective of civil society and communities as well. Next. The progress list is endless. Have an early COVID-19 Christmas. Thank you. But before I wind up, I still have my time. I want to take you through what I think is the priorities, the CRG priorities and disease programs that Africa and other continents have to look at. This would be building evidence on your CRG priorities, very critical. Then identifying goals and develop your strategies, very key. The mapping out your stakeholders. I believe we need to identify, empower, and engage, because we have communities out there at the grassroots that are really key stakeholders, but they cannot even write winning proposals. Then reach out to others and build collaboration like ACT has done. This is a part of building the collaboration. Identify gaps and challenges and address them early on using existing guidelines and resources. Thank you very much, ACT. I'm impressed that you have achieved this great leap in ensuring leaving no one behind and ensuring meaningful engagement of communities and civil society. Kudos. Thank you very much.
Thank you very much, Paul, for highlighting what the Civil Society Task Force, the WHO Civil Society Task Force has been doing, and for the contribution so far, and also providing us with guidance on other things we need to be focusing on, such as mapping out stakeholders, building capacity, and strengthening collaboration among civil society actors in the TB space. Thank you very much. I think that you will agree with me that the panelists have shared with us a wealth of information, going from what's going on, what we need to do as civil society, as well as opportunities for engagement. So clearly, our work is well laid out and called out for us. We know what to do. We know the opportunities to leverage on. So the onus is on us as civil society actors to take up, those opportunities that the panelists have shared with us to ensure that we're more meaningfully engaged and we can contribute our quota to ending TB in our lifetime. I believe there was a question for Dr. Mancini in the chat box from Lynette. I don't know whether, Lynette, your question has been answered yet, but I just wanted to draw Dr. Mancini's attention to that question so that he could respond in the chat box. I believe that we have run out of time for this session, so I want to ask that if you want to engage with the panelists, please drop questions for them in the chat box and they would be able to respond to you. So thank you very much for a very engaging session. Thank you to all the panelists. And I'm going to hand over now to Evelyn, who is the chair of the next session. Evelyn, over to you. Evelyn Kabuchi?
Yes.
Okay.
Thank you so much. Thank you so much, Olaide. And I thought before this session, we were to have a 5 minutes break. Does that still hold? Olaide?
I think Chief will guide us on that.
Okay, Chief, you could guide us on that.
Thank you, Evelyn. I think we were supposed to, no, I think this section is supposed to continue. The break will not happen now. The break will come after this section. We intend to end before lunch. Thank you.
Okay, thank you so much. You know, I was looking
to inform you that I've also shared the form that you're using, that one that you're using on the chat.
Okay.
In the chat box.
Thank you so much. I was looking forward to the break. You know, in normal circumstances, the breaks were used for hugs, memories, and people catching up. But in lieu of those breaks, we have to do with what you need to do with given the circumstances. Before I jump into sharing this session, I just want to give us a brief background of where we have come from. I started working on TB advocacy during what I call the dark times of TB response. That's by my own definition. In my own country, we had no adequate MDR TB drugs, and the country could only put a limited number of patients on MDR TB treatment. And by then it was only 40. The rest were put on a waiting list until the 40 had cleared, and then the people in the waiting list would be put on treatment. And of course, most of the people in the waiting list died. It was a time when there were no human rights. Human rights was not an issue. We're not sensitive about human rights for TB patients. Again, in Kenya, TB patients, when they failed to adhere to their treatment, they were jailed. There was very limited civil society engagement. There was very limited, if at all, engagement of members of parliament. There were no advocates. There were no champions. In many countries, there was no budget line for TB. Of course, needless to say, there was no technology like the GeneXpert. The available MDR TB treatment was long, with the injections that you all can relate to, for those people who are TB advocacy then, as in it was a dark moment. But all that has really changed. And what has changed? The engagement, the involvement of civil society and communities. I have given that history because I often feel like we forget the progress that we have made, and we always tend to focus on the challenges that we are seeing. So for the next session, I want us to make plans that will constitute history for the next generation of TB advocates. What the TB advocates of the year 2030 will give as a history. We are going to form that foundation in the next 30 minutes. So welcome so much, or karibuni in my language. In this session, we are going to look at what are the advocacy priorities. What priorities as countries are we going to look into in the next session of advocacy, and what issues will constitute the African regional advocacy plan. And because we don't have breakout rooms, breakaway rooms, where countries could have made discussions on what their priorities would be and then report back, I want to open it as a plenary session, and I want to invite countries to just mention one or two priorities in their countries, and one or two priorities that we feel should be included in the regional advocacy. I will leave it open for anybody to jump in, but if possible, let's just have one representative from each country. And then Austin has shared a form which we are going to complete later. We are going to complete it with the priorities, and that is a form that is going to form the basis of our advocacy plan for the next maybe 1 year. So I open the floor. feel free to just mention 1 or 2 advocacy priorities in your country and 1 for the region.
And Evelyn, they can also use the chat box to also say it in case if they feel shy or stuff.
Yes, feel free to also put it in the chat box and we are going to capture it. So which country is going first? You can put up your hand and I will see you and I will call you out. Anyone?
Yeah, can I say something, Evelyn?
Yes, Eddie.
Yeah, maybe hi all. I just want to say that maybe one of the key priority agenda from our perspective in our community is our meaningful engagement in the any country process, in any TB control and prevention activities. One of our key agendas is we have to be meaningfully engaged in all those processes as a community, and also maybe related to the missed case finding and the affected population intervention in human rights is also the second and the third. Thank you, Evelyn. Over.
You said human rights and finding the missed people. Okay, thank you. That is Ethiopia. Thank you. And also to note that after these countries will sit down as groups and complete that form and share back with ACT for compilation. Thank you.
Hello?
Yes.
Hello?
Hello.
Yes, this is Paul. Yeah, hello?
I can hear you, Paul.
Yes, yes, CISMAT Sierra Leone, working on TB, especially household door-to-door TB screening and referral pathways involving informal health providers. One of the advocacy priority we think is very, very eminent is advocating for resource mobilization. So one of the challenge we have, resources allocated for TB is not enough. In fact, even from the Global Fund, is not enough. And then the country-owned fund, we here, for example, Sierra Leone, the country-owned fund is not there, So we want to advocate that our national governments also put a budget, through parliament to fight tuberculosis, because this is actually absent. And that is why we cannot scale up our TB interventions because of the limited resources. Like you think of HIV/AIDS, they have so many funds, malaria, but TB is the least supported disease. So I think this is an area we can also advocate.
Okay, thank you. That's Sierra Leone. They're going to prioritize door-to-door sensitization of TB, engagement of informal healthcare providers and advocacy for resource mobilization, and asking the government to increase the allocation to TB. Thank you so much, Paul.
You're welcome.
Next.
Hi, Evelyn. Thanks so much. This is Tapua from Zimbabwe. At country level, I can say there's quite a lot of advocacy priorities. One of them is on contact tracing the contacts of people who have tested positive for TB. The other one is preventive therapy to people who are at risk of developing active TB. So those are, I think, are the two strong advocacy priorities. But at regional level, I think we are seeing a lot of drug-resistant TB, in countries with high TB burdens. And we need to see more action around the available medicines for MDR and XDR TB, And those include delaminate, they include bedaquiline, they include pretomanid. I am aware that MSF Access Program has been advocating a lot around, especially delaminated bedaquiline, and there's some patent oppositions, but I think we need to see more actions in Africa pertaining to the accessibility and affordability of these medicines. But we also need to prioritize the reduction in the price of the cartridges for the GeneXpert resistant tests. That is really critical so that it goes down from around $20 per cartridge to $5. Thank you.
Oh, thank you so much. Yeah, that was those were good priorities for the regional level. The accessibility, affordability of MDR-TB drugs, and the reduction of prices of cartridges. Thank you. That's an issue I think we need to prioritize at the regional level. But I've also taken note of what you have brought out for the country, for Zimbabwe. Okay, next. Any other country? Any other country?
Thank you.
Yes, we have Matimeri from Nigeria.
Thank you, Madam Chair.
Okay, thank you.
My name is Bertrand Campoy. Can I speak in English or in French, please?
Okay. I believe that there's translation services, so whichever language you feel comfortable with, we are fine.
Okay, so we have, so from my point of view, not in my position of regional coordinator of RAP-TB, I mean, we can have 2 or 3 priorities. The first one is in terms of intervention for children and adolescents. Yeah, because we need to, the data we have in the region for children and adolescents are very, very, very weak. So we need to strengthen intervention, including preventive treatment and active care feeding for children and adolescents. This is the first point. The second point is around stigma and discrimination, because in our region we still have a stigmatized language on policy document guideline. So we need to make sure that we humanize the TB language in all the documents.
Yes, Bertrand.
So the last point is in terms of TB in prison. Maybe we can also, because TB should be a multi-sectorial action. So we need to work with those on the legal system to improve the policy in terms of the prison, because our prisons are overcrowded. There is no alternative issue for the prison community. So we need to advocate for that, because as our country, we don't have a lot of money to take care of the prison population. So we need alternative decision for the prison. Okay, this is the first.
Thank you, Bertrand.
Thank you, Madam Chair, and dear friend.
Thank you. Thank you so much. So from Bertrand, adolescents, and the biggest elephant in the house forever, stigma and discrimination, TB in prisons, and also giving TB a multi-sectoral approach. Thank you. Next, which other country wants to go next?
Thank you, Madam Chair. I would like to submit, I think it's only 3 points on the advocacy opportunity that we are actually looking at. It's one is the domestication of the SADC Declaration of TB in the mining sector and its operationalization of the SADC Code of Conduct.
Sorry, which country are you speaking from?
I'm from the SADC. Okay. I'm representing the Southern Africa Miners Association with affiliates in 8 countries.
Okay.
We would like to put these 3 points. One is the domestication of the SADC Declaration of TB in the mining sector and the operationalization of the SADC Code of Conduct on TB in the mining sector. And then the second one is the implementation of TB-sensitive social protection for vulnerable population, where we are looking at supporting on transportation to access health services and food and nutrition. And then the third one is improving knowledge on TB as prevention, especially to adults and children, and the reduction of stigma and discrimination at workplaces on TB, especially in the mining companies. So I submit.
Thank you. Thank you. That's Vamajele. Vamajele. Sorry about mispronouncing your name. Yeah, you have again brought some issues that need to be looked at the regional level. The domestication of the SADC Declaration, the Code of Conduct, and the social protection for vulnerable populations, and of course, the stigma. I think stigma cuts across all countries. So we are taking what is appropriate for the regional level, and then the rest for the country level. Thank you so much. Next.
I noticed that Ingrid's hands was up. I don't know whether she still wants to speak.
Oh, Ingrid. Okay, sorry, I have not seen your hand. Just pick up.
Thank you, Evelyn, and hello, everyone. In South Africa, TB Proof has been working with community health workers, and to advance universal health coverage, we all know that they are actually the ones doing the majority of the work to promote person-centered care, free of stigma. But we are focusing, there's a community health worker policy released 2 years ago. It's not implemented, and that is what we are pushing for as civil society, because it has their scope of work, their training needs, infection prevention control equipment, and remuneration as advocacy points. I did post our report in the chat, and yes, we are very passionate, and we hope that there will be change for community health workers to be supported in the health system. Thanks.
Thank you, thank you, thank you. You had put some comment on the chat. I'll look for it and also summarize it. But you have talked about the healthcare workers and the lack of implementation of policies, which is again is a problem that cuts across many countries, and we also need to look at how do we ensure that policies are not just being developed but also being implemented, and implemented fast, and of course having a budget line for them. Thank you. Which country jumps in next?
Sorry, maybe my last advocacy submission would be advocating for integration of access to services. Let's say one-stop shop. If we have the malaria, for example, TB in one place, so that this also can help fight the stigma we're talking about. So it's not too common in most countries. We have TB treatment centers that are far different from HIV treatment. So is that possible to advocate for integration so that TB cannot be seen behind? So let's see TB and HIV moving together, and then so this is what I want to submit as well.
Thank you. Integration, I believe, is also promoting efficiency. Good point. Ibrahim, you want to say something?
How are you? Thank you, everybody. I think for us,
Ibrahim, we can't hear you very well. No, your network is not very good.
Can you hear now?
Okay,
Hello?
just talk.
Okay.
Talk.
For us in Nigeria now, the TB response has never been threatened as it has now because of COVID. So for me, my first priority is properly putting TB response better, in better perspectives. And that way that can best be achieved through improving domestic domestic funding from the country. That might be my very strong point for our advocacy point. Then we need to keep up advocating for active case finding because our case identification is still not very interesting yet. And putting in place right programming to address community rights and gender. And if you look at the points of rights and gender, stigma and discrimination is inbuilt there, just as you have said, is a generic thing. And I'll align with some of my colleagues who have presented. Improving care for prison inmates remains critical if we want to get out of it. These are things, some core issues we need to look at from the Nigerian perspectives. Thank you.
Thank you, Ibrahim. Again, rights, human rights and gender, active case finding, domestic resource mobilization stands out across every area. And of course, to continue prioritizing TB, especially now in the era where we have COVID taking almost everything. Okay. We have any other session? Any other country?
Yes, this is Olive. I just wanted to also comment on Tanzania, but also come broadly. On Tanzania, I think it will be the same issue around prioritizing domestic resource mobilization for the response, especially when it comes to TB. And there's a lot of discussions around the HIV committee integrating TB, which I think was successful, but we want more commitment to funding for the TB response. And then the other thing is, just like what Vama said, Tanzania has a very big mining key population when it comes to TB. And then there's that lack of integration between the laws, these are labor laws, and the TB response. So would really want to make sure that labor laws are implemented, and then that there should be a multi-sectoral response. Yes, things are happening, but I think we can do better. And I think that links to the SADC thing that Vama talked about. Broadly, I also wanted to talk about childhood TB. You know, no one talks about children, and children cannot talk for themselves. So we also need, some increased effort towards finding children with TB, but also making sure that they are on treatment. And this also talks about the ungender realized response to TB by our countries. And I feel like this is a good time to also talk about gender transformation, increase engagement and empowerment of women in the TB response. Women need to know what TB is around and how to respond to TB, get the right to the information around TB, but also access to health. In that process, we'll also see an increase in childhood TB. Thank you so much for that.
Thank you so much, Olive. You brought again new issues, for example, the labor laws, employment of women as a strategy to improve TB response, and of course, domestic resource mobilization. I think this one has to come from every country. And with that, because of time, I want to end there, but remember, we have sent by Austin in the chat box. Let's use that form. Let's complete that form, share it back to the organizers, and we're going to what countries, individual countries, and what can be addressed at the regional level. I really appreciate, I was really looking for Kenya to speak, but because they didn't speak, I will speak on their behalf. And my point is just one. Men, men, men. Olive has mentioned about the women. I want to talk about men. We have to be sensitive. We have to be to prioritize the population that are really affected by TB. And in Kenya showed men are more infected, and therefore we need to have a focus, special focus on men in a bid to achieve the targets. Remember, we have very ambitious targets, and we are almost coming to 2022. And somebody will ask, what did we do as civil society? Let's have an answer for that when we are asked. Thank you so much. Back to you, Austin.
Thank you, Evelyn. Thank you so much for sharing this section. This is so wonderful. I loved it. I wanted to contribute to what I said. They will say, oh, let's just wait for the right people, the awesome participants that we have to make that contribution. We'll be looking forward to your contribution via the form that I sent by countries. This will help enable to inform the overall regional advocacy agenda, and also help you also in grooming your own advocacy agenda in the country as well, because we're all here to support each other. We'll be going on break immediately. Just quick information. The break will just be for 5 minutes because Luchika is joining us to launch the SCORE TB campaign in 5 minutes. So what we'll do is just for people to stretch out their body. I know that, hours of sitting, sometimes you need to really work out as well to make sure that the blood flows. And we'll go now for 5 minutes. Enjoy yourself in the stretching while we come back to wait for the launch of the SCORE TB campaign. After then we can go to the next agenda. So we are moving the second agenda to a little bit further so that Luchika can have the time to launch, and then we'll all continue. Thank you very much, and thank you for participating in this first section of this morning, and we will go for the break. 5 minutes, we are back. We'll be back at 10:05. Thank you.
Thank you.
Hello, everyone. Welcome back from the little break. I hope you're able to stretch your body after this long hour of sitting. I'm going to invite Mayowa to chair the next session. We have our lovely Ruchika waiting. She's on standby to launch the SCORE TB campaign, the Sustainable Communication Response for TB. But we'll have Mayowa to chair this section and also to give us a little brief. Mayowa is actually the Executive Secretary of the Stop TB Partnership Nigeria. So Mayowa, you have the podium now. Thank you.
Hello, Austin, can you hear me?
I can hear you now.
Okay. Good afternoon, everybody. I'm so delighted to be moderating this session. I've been part of the conference also since yesterday, and I'm very delighted at our participation as a civil society in Africa. And it's good to know that despite the challenge of the lockdown, we are still able to hold this event. For me, that is a remarkable success. And so, though we cannot meet face to face, I'm very glad to be able to hear our voices and see some few faces and so on. So this session is basically to launch the SCORE TB awareness campaign. And what is the Stop TB awareness campaign? The SCORE TB itself, the acronym, stands for Sustainable Communication Response for TB. And the rationale for this campaign is to bridge or to address the challenge we've had as regards the need for continuous and sustainable TB communication in our respective countries. We all know that during World TB Day, TB is always in the news, at least for that 1 week that that the World TB Day is going on all over the world and in our respective countries. There's so much noise about TB. But after the World TB Day, the question is then, it seems TB has gone to sleep. There is very little or no information again in the media until another World TB Day. And this is not supposed to be. A senior colleague of blessed memory, Omololu Falobi, said, if it is not in the news, then it doesn't exist. So whenever TB is not in the news, then it doesn't exist. And this is the challenge that SCORE TB we like to address. In Nigeria, for example, we Stop TB Partnership Nigeria is traditionally responsible for organizing press conference every World TB Day. So it's like a statutory role that we have been given. And we do this every year in partnership with other stakeholders. But we discovered that after that, the hype that has been created during the World TB Day, there's no more news about TB until some other times, except some few activities that are reported here and there. So we, in collaboration with our media correspondents, we started an initiative called TB Media Roundtable. The TB Media Roundtable is a monthly webinar focusing on TB, and the primary target audience are media correspondents from all over the world. We started by creating a database of health correspondents of media organizations that we've been working with, and then we developed a communication platform for them, and specifically WhatsApp.
Mayo, are you there?
I think his connection dropped.
Mayo, are you there?
Missing.
I think it's having challenges with his network.
I think Mayo is having problem with his connection, because I think he was just
coordinating of this partnership in Nigeria.
Hello, can you hear me now?
We can hear you now.
Yes, yes, Mayo.
Okay. Well, sorry, you forgive me. Nigeria, we still have this technology misbehaving every now and then. And I guess that's similar in other countries in the region. So as I was saying, we started this initiative as Stop TB Partnership Nigeria, working with the media to organize what we call the TB Media Roundtable. And this has been largely very successful because the focus is on the media, and right now we have about 100 media correspondents, specifically health correspondents, who joins the webinar. And then what they also do is, after they write their story and share it to the public. And this is not just on the traditional TV or radio media, it's also so we discovered that every month in the news, social media and the traditional media. And the uniqueness of this initiative is that it's not just in English. We also have this information in local languages. So this initiative has been able to reach millions of people. Another very good example of how to sustain TB communication in the media is also the example of the TB talk show with celebrities. That was started by Stop TB Partnership. Again, this is a very unique way of ensuring that TB is in the news, but it's more especially, it's not about talking about the art stuff, the data, the epidemiology. Stop TB Partnership with the executive director, Dr. Lucica herself, moderates the session, invites celebrities from different countries, and talks about TB as if you are talking about sport or you are talking about fashion, but not losing the importance of the urgency of the need to address TB, but at the same time talking about it in a very lively and jovial environment. This we've had some TB celebrities, TB champions in Nigeria participated also in this TB talk show. So you see that there are many ways whereby, as countries, civil society, as partners, we can sustain TB communication in the public through innovative approaches. So we believe and hope that this initiative, SCORE TB, we also respond to this, to address this gap. And that is why ACT will be developing a media platform for SCORE TB. This platform will showcase what each country is doing and also include efforts as TB at the regional, at ending TB at the regional and global levels. Lastly, the SCORE TB will also be addressing a very important issue, which is the disparity in the disease split by the Global Fund. So the SCORE TB will also be initiating a campaign called TB 33% campaign. The TB 33% campaign is an advocacy to the Global Fund to increase the TB allocation or disease split from 18% to 33%. We all know that more than ever before, TB needs more money. A lot of the resources meant for TB had been used, or let me say diverted, for COVID-19. And but most importantly, the data shows that TB needs more resources, and the 18% being allocated by the Global Fund is not enough. So I'm going to stop here, and I'm going to invite Austin Ebefuna to give also a very brief information about the SCORE TB initiative, and then later I'm going to invite Dr. Lusika Ditu to launch this campaign. Thank you, and
we need to invite Lusika first to speak. Then I have a short video to play once I launch the SCORE TB.
Oh, okay, great. So without much ado, it's my great privilege to invite Lusika to launch this SCORE TB campaign. Lusika, over to you, please.
So thank you so much. And actually, it's me to thank you for two reasons. One is for having this great initiative. And, you know, and because everything you said, Mayowa, and everything, Austin, you shared early this morning, I think it's not only spot on, but very needed. But more than that, I want to tell you, all of us, that you know, today is 28 October 2020. We all need to remember this as a very amazing and historical day, because it's really great from where we used to come as a TB community to see so great initiatives coming from especially from the African region, where we have such a big burden, and having it so much focused around tuberculosis, and being a really national organizations initiative and push to come together to keep the spot on TB along the year, and to push the agenda with celebrities, with decision makers, and obviously with and through media. This is absolutely amazing. And I would love to live the day that we have the same in the other regions as well. I'm happy that Africa is the first in doing something like this, because in a way, you know, you can be like, I feel so happy about this. I feel really so, because it's so much that we can create together. And from the Stop TB partnership, we will support this a lot, because we have in the countries, as you know, supporting Stop TB partnerships. So we will be able, hopefully, if everything is fine and our donors remain as open-minded as they are, we should be able to even channel through Stop TB partnerships to support them, to help with this kind of events of gathering celebrities, journalists together. There are also challenge facility grantees in the countries and a lot of other networks. So we can really, if this is an initiative to keep TB, focus on TB, and if it's like an army having the same message, okay? It's not that, okay, in one country is a message about vaccine, in another country is a message about diagnosis, in another country is a message about something else. Let's do some focus campaigns in which there is one line, whatever is decided, one thing that is going forward, and then everyone goes on that. And that's the pressure till the things is changed. And, you know, there are so much areas that we can focus on that I think this is really, really great. So congratulations to the idea in initiative and to push it forward. And we will, this is really like not music to the ears. This is really what we should do. And we should push together. It's amazing to have so many voices that we can amplify our messages. And I want to also say that I really thank you all that are on the call, because we are not as funded as HIV used to be, you know what I mean? And I know that a lot of these are done with some resources, but very little. A lot of you are volunteers, or most of your time you do something else and devote a little bit here. So it's really impressive what is achieved with very little and very few resources. And going to resources, I just want to say that that there is a lot to speak about resources. And as I said last time, the Global Fund strategy is in the development, and a lot of things that can be done, you know, thinking of the Global Fund support in the countries, especially in the African region. So thinking together about financing and increasing financing and pushing together agenda will be much more helpful, because as you know, I will never cease in pushing this, whatever it happens. And for the good of everyone there, and for the, you know, we need to be able to look into each other's eye, okay? And we can maybe not be able to achieve everything we want, but we do whatever it can, that we can be honest to each other and say, I did my best. I really fought hard. I really didn't step. I tried to help with this. It went so far, maybe it didn't work out and so on, but we need to do whatever it takes, because we are in a way in a privileged position, for sure myself, as I said, in being able to represent the voice of so many other people. So we need to fight for them. So you get all our support for this, even going forward. I think it's absolutely spectacular that we will be able to construct things there. And it's absolutely great if everyone can get aligned and engaged in this, in getting one, how to say, one advocacy or one communication message at a time with a campaign, because we hope, and I'm happy I see James, my colleague in online, and Tandy as well, to be able to push the agenda in other regions in the same way. That is a global one, but regional one, sorry, and then reaching the global level. But I'm very happy this is happening in Africa as the first one. Full agreement on the fact that TB needs to remain in the eyes of media and in the attention of the public. Many years ago, I worked for a journal. So as you all know, and for several years, in parallel of being a doctor, because the salary being a doctor in Romania was $30 a month, working for a journal was $300. So you can understand that there was a trade-off there. What journalists are always interested are not the good news, are the bad news. So in pushing agenda forward, we don't need to be negative, but I think we need to be challenging and outspoken, and always coming from civil society and everyone that is on the field and knows much better. I think highlighting these things without any stop, it will get us somewhere. But This is really great. I don't want to take a lot of time, but full support for this, full support for the different campaigns that will come under this SCORE TB agenda. I like the name, very smartly structured, and let's do this. We will support from Stop TB whatever will be needed. Thank you so much, Austin, and thank you, Mayowa, sir. Thank you.
So thank you so much, Litika. As you have launched this SCORE TB campaign, I have a short video that Roderick will play so that we're already around this campaign. It's something that is really needed in Africa and also globally around the world. Welcome back again to the Africa Regional Meeting on TB. It's great to have all of you here, great participants, great panelists, great presenters. This actually offers us a very big opportunity to launch a very big campaign that we've been anticipating, sitting in the background to walk around to see how we can actually mitigate this communication gap that we have in TB, because we know that after World TB Day, nobody hears anything, no awareness campaign, nothing happens again. But now we are launching a very big campaign program, which is called SCORE TB. SCORE TB, Sustainable Communication Response on TB. What is the aim of this SCORE TB? The aim of this SCORE TB is actually to engage all sectors, engage everybody, engage communities, engage private sector, engage public sector to make sure that we sustain the communication on TB and also sustain advocacy that we need to gather around the high-level meeting targets. We definitely know that we are not on target when it comes to TB. TB is actually been TB is one of the killer diseases among all the infectious diseases. TB kills more than HIV and malaria put together. Yet international funding for TB is half that of malaria and also 13% that of HIV. To achieve the UN high-level meeting target, the world has committed to mobilize $13 billion USD per annum. Currently, only half of the amount is available. Unless external funding is stepped up, the world will not achieve these targets for 2022. What are we trying to say? What we are trying to say is that TB still remains a challenge in terms of resources to be able for countries to mitigate the interventions around TB. TB grants have utilized 97% of their disbursements, but the list of unfunded activities remains high. Similarly, absorptive capacity of TB grants is at 82% and TB HIV grants is 89%. This is coming from the Strategic Performance Report mid-2020. What does that mean? What it means is that countries are becoming very much ambitious. We need to step up for TB. We need to do that. But before we even do that, we need to rally around a very strong campaign, the SCORE TB campaign, to rally around how we can be able to push forward and make sure that TB is actually put on the agenda. We speak every day about political commitment. We speak about domestic financing. But the people championing the TB epidemic in terms of resources, Global Fund, where are we? We cannot remain under 18%. We want 33%. We want 33%. We want 33%. We want 33% for TB within the Global Fund. We need to live by example. We need to practice what we preach. What we want is 33% upwards. We do not want the 18% anymore. TB is being neglected by not only by the domestic finance, not only by governments, but also by Global Fund now. How can we remain under 18% for several years? We need to move on. We talk about COVID-19 opportunities. No. Countries, we have seen that COVID-19 have taken a lot of money from TB. And what does that mean? It means that we are left with nothing. We need to move forward. We need to make sure that TB 33 campaign move forward. We want Global Fund to increase the TB allocation from 18% to 33%. That is the campaign that we are going to push for now. We want every civil society community to support this campaign. That is what we are going to fight for. Next Global Fund Board meeting, we are coming in our numbers. We are coming with our campaign placards. We are moving forward. We are giving you the data. The data is there. There's nobody that doesn't know that TB is so devastating in not only in the African continent but globally. We need TB 33%. We want it now. In the lives saved estimated of the Global Fund, lives saved due to investment in TB is the biggest proportion of all lives by the three diseases, with an estimated 60 million lives were saved through TB diagnosis and treatment between 2000 and 2019. Since 2002, the Global Fund has reduced the number of TB deaths by 25%. What an example. What an example. Illness with symptoms similar to COVID-19. The impact of COVID-19 pandemic on TB has been more severe than the impact on HIV or malaria. As the Global Fund stated in its most recent situation report, COVID-19 threatens the derail the years of progress. I remember Peter Sam saying during the WHO function, he was asked a question, what has contributed to the successes that we still talk in TB as of today, even with the COVID-19? His response was money. It was the money that we have put in TB. So we want to see more resources in TB. We want to see more money in TB. This is what we want to see. In the African region, there has been over 500,000 deaths compared to 27,000 COVID-19 deaths. The TB deaths are 180% more than COVID-19. But we've seen so much political will, so much political attention around COVID-19. What are we doing for TB? Absolutely nothing. Nothing. We are calling on Global Fund to increase the allocation for TB 30 to 33%. We want domestic financing as well. We want political leaders to also put in money for TB. When you put in that such money for TB, what it means is that Global Fund will be motivated actually to increase this TB 33% campaign. TB 33% campaign all the way. TB 33% is what we want. Let all civil society, let all communities support this campaign. TB 33% campaign, you see us there. Thank you.
Great work.
I want to invite Luchika to say something before I hand over to the chair.
I will just say very briefly 2 points for all of us. First of all, this is a fantastic job. Austin, if your team can share with all of us the link to the video, because we need to share this wider. I think this is a great momentum and we need to grab this and run. I didn't want to, when I spoke before, I didn't want to speak about the 33%, was about how you come together under a big umbrella of SCORE TB for different campaigns and now taking on the funding, especially from the Global Fund. It is the right moment. It is the right moment for us to also, give the ask for what is needed and be without hesitation, and I would say without being shy, because for a too long time in TB, we always accepted to do much more. Everyone, like, do more with little money, do whatever. Traditionally in TB, we never had the resources needed. And unfortunately, with the Global Fund, the 18% is a pathetic amount. And it's a revolting situation in which we all are, that even though TB kills more than HIV and malaria together, TB has a huge burden, an impact, and it is airborne. TB gets the least. You know, it's like, you don't need to be Einstein. If you go back to your kids at home from the age of 6 and you say, you know, there is this that kills all our people so much more, but we give them little money. It's like just keeping us a bit alive, you know, like take some money to do something, but never being able to go. So the money that we have to achieve for TB, as Austin said, is less than half of what should be. So people that want us to achieve full ending TB by 2030 is not possible with that little, with less than half. It's like you build a house, you make a plan, you say it will cost this much money, and then after you start constructing, you realize you have less than half. So what do? You start being innovative in cutting some parts of the house and trying to see what you do with it. But it will never be a house, right? It will be something to hold you, not to rain on you, blah, blah, but never the full house. So I think this is absolutely great. We would like to see how we can take this with other regions and with other, but this is fantastic because in the African region, as you said, we have a specific problem because indeed there is a significant gap between where countries should go and where we are. So we will need to go ahead with this. As Stop TB and other partners, I imagine, and donors, people will be fully supporting this because this is a theme that is very important as other coming, because without money, we don't achieve anything. And it's enough on the fact that prioritization and access to tools in TB world was not dictated by rights, was dictated by the fact that we never had money. And the TB program managers were always scared of basically putting even in their plans everyone that is in the need, because they were aware they will not have the money. So they're like, okay, we can cover just 40% of the, no, we need the money, we have the reasoning, and we will have to get it. So for anything that you will need, we will discuss more in detail, but also the numbers, as you said, Austin, and the data to be able to construct will be very good. I stop here. I'm very impressed. Let's do this. Thank you very much.
Thank you very much, Lucica. Always very inspiring to hear from you, and thank you for the passion, and thank you. And we have the army to work with you. Very passionate people to support you in this cause. So on that note, colleagues, it's obvious that we have a lot of work to do. First, in keeping TB in the public by ensuring that the media is aware and constantly aware, no matter how seemingly little the issue is. Let's make sure that we put it out there. And most importantly, on this TB 33% campaign, we need all hands to be on deck. More information will be on how every country will be connected to be part of this initiative. On Lucica for joining us to do this, everyone on the platform right now. Once again, thank you. Enjoy the rest of the meeting.
Thank you for chairing this section, and thank you everyone for participating. I read your wonderful words from the chat box. We are so happy that everybody is on this campaign. It's something that we really need to push. The website will be scoretb.org. We'll be launching it during the retreat, the civil society retreat at the Stop TB Partnership Board meeting in Nigeria. So the website will be launched, and all the links to the awesome campaign will be shared with all of you. We are so grateful that you're all part of this. You are all members of ACT, so you're all part of this campaign that we need to push. It's not only about increasing Global Fund, increasing the disease split for tuberculosis, but also we ensuring that our countries increase the domestic finance, in TB. We've seen how political leaders pushed for COVID. So it's something that we need to also push. We cannot, the civil society is the only one that can do it. public sector, government does not fight government. If you're waiting for NPP, waiting for your Minister of Health to speak to the highest political leadership in your country, that will never happen. It is we, the civil society, that need to do this. We need to also the support of the partners. We've seen Top-Up Partnership supporting this initiative. We need support of all the partners. We also call on our partners like USAID and all to be able to support this as well. We need real support to be able to make this demand happen. And I see a Global TB Caucus already, Evelyn, saying that yes, we need 33%, TB 33% all the way. So we'll end this section now and move on to the next section, where I will invite Chawanga Modongo to share the section. This section is about know your global representatives. So after this section, then we can now move on to the HLM. Thank you. Chawanga, can you take up the floor? Thank you.
Yes, thank you very much, Chief Austin. That was very inspiring indeed. And my name is Dr. Chawanga Modongo, but I'm known as Chawa. We are the new kids on the block. I represent Victors Global Botswana. In Botswana, we just got established in 2019, and we just started operating this month. And with the support of ACT Africa and WACI, we'll be able to establish a national network of people affected. Anyway, in regards to this session, it is a session that way we will get to know our global representatives. They'll give us feedback from the most recent Global Fund board meeting and key decisions. It's a 20-minute session, and I'm assuming that each person will get 5 minutes. So Austin, could you please go ahead, 5 minutes? Hello,
thank
Austin?
you, Chawa. I hope you can hear me, because I was finding it difficult to hear Chawa while she speaks.
Oh, okay.
My name is Austin. I represent the developing country NGOs on the Stop TB Partnership Board. You already know about the Stop TB. It's not something that I alone can actually introduce here, because the Stop TB household name all of us who are working with TB. With the developing country NGO constituencies, which is actually the biggest constituency within the Stop TB Partnership. We have, apart from the constituency, we have a smaller delegation of 10 people, all the across the world, globally. We have somebody like Mayowa, who is also on the delegation. We have Philippe. I'm not sure who is sharing. Okay, we have Mayawatu, who is also part of the delegation, and Oli Mumba is also part of the delegation from Africa. So we have other people from Asia, South America, and quite representative. We'll be sharing a call for the delegation election. We also make available the manual all the constituency members, so that you will know the kind of work we are going to do. I must tell you that Stop TB Partnership is awesome, in as much as we always do that there's a lot of great work to do. Yes, we want you to bring innovation, but the partnership is really awesome. So this is what I have to say for that. Thank you, Chawa.
Yeah, hi, sorry, Austin. I'm also having difficulty in hearing you. Can you hear me? Hello? Hello?
Yes, we can hear you.
Oh, you can hear me? Yeah, I had difficulty hearing Austin. The next person will be Maureen Morenga, who represents community delegations to the Global Fund Board. Maureen? Is Maureen available? If she's not, Evelyn, would you be able to take her from there?
Yes, I can. I was meant to talk about the civil society, which Rogers Kamugasha already made a presentation earlier. So I don't think I want to add anything unless maybe there are questions that may arise from his presentation, and then I can respond. He made a very comprehensive presentation on what is the civil society task force, what is our terms of reference, and the success we have achieved so far. So I don't think there's need for me to repeat.
Okay, thank you very much, Evelyn. Maybe after the last PCB UNAIDS, we could, because we have time, would you be able to take questions? Can you take questions? A representative from PCB UNAIDS, are they also on? Is Maureen around? I think because we have ample time for this session, because there are people who are not available, could you please take questions? We'll open the floor for questions. I think you can take questions even if it's not related to this particular session. It can be from the previous sessions.
Hi, Chawa. Sorry. Hi.
Yeah, go ahead.
Oh, hi.
Go ahead, Wendy.
So thank you so much for this, for giving me to speak on this session about questions. I previously raised my hands when countries and regions were sharing their advocacy plans, and there were very good plans and nice ideas. But my advice on this one is that I think that the advocacy plans, when the countries share and the regions share, should be really, really context specific. For example, I've heard the broad advocacy plan saying that we really need to increase active case finding or detection. For me, it's an advocacy plan that can be applicable in any country. For us, for you to make sure that it's Nigeria specific, there has to be some context, and it should be based on evidence that is recently collected. And the other thing, the aim of each advocacy plan should be very clear. It should be measurable so that in 2022, we are also able to say that we are from here in Nigeria, and therefore we are now here because of our efforts. And I'm hoping that the interventions will also come with specific activities that can easily be fitted on a logical framework, just to show everybody where we were, which road you took for advocacy, and what came out of it.
Now I see James' hand up.
Sorry, James, please go ahead, James. Yeah.
Well, thanks so much for the session. One of the things I just thought would be interesting to discuss here is, sorry, I just had a dog jump up on me, is the fact that I guess meeting your global representatives is really, really important. so that you know how to engage with global level institutions. But it's also really important for what it represents in terms of community participation in governance. I think in TB, one of the things that we really noticed is the lack of that community level participation and governance at the country level. So I think that there's hopefully opportunities to build off what's happening at the global level and see that replicated at the country level and vice versa, so that broader community system can be built. And I just note in the context of the community delegation and NGO delegations for Stop TB, we're very hopeful that they'll be funded to be formalized and that sort of role can really be scaled up. So just wanted to add that in and also see if anyone had reflections about how to strengthen that community governance angle as well.
Okay, thank you, James. Is there anyone who wants to add on to what James has said?
Hello? Hello?
Comment? Yes, go ahead.
Yes, Paul, Freetown.
Now, can you look at the participant list? I think I see Olive and Evelyn. They have raised their hands.
Okay, let me see. Oh, right, sorry. Yes, Evelyn. Oh, sorry, you can go ahead, sorry, and then Evelyn can talk after you.
Okay.
Okay, I was just going to ask a question about the campaign. I am fired in my spirit when I saw 33%, because this is affecting us here. I can remember when we are working on the just concluded Global Fund request processes, we are forced to reduce our activities because they said what they have for TB is this amount. So it's like we are forced to prioritize some activities. All of the activities we actually drawn up are all important, but they will say no, that the funds are not going to allow us to go above. So we are forced to, we did it, we are constrained to do that actually. So it's very good to see that this campaign is coming up. But I want to ask, is this campaign having a deadline? When are we, because for me, I think we are very much interested to see that Global Fund adhere to this campaign, and this 18% is removed and 33% is increased. So do we have a timeline?
Can I respond?
Austin? Yeah. Go ahead, Austin.
Can I respond?
Yes, please, go ahead.
Yeah, thank you. First of all, thank you, Sarah Loon, for being on this meeting since yesterday until now. The campaign is not ending now, and I'm happy that you even mentioned the challenges that we have in the country. That's why this campaign is not just only for the Global Fund, but also for our countries to increase their political will. Domestic financing for due to lack of funding. We are asking, we are telling Global Fund that we need that because we have the data. We have the data and we continue sharing the data that we need more money.
Hi, sorry, Austin, sorry for interrupting.
The country,
you're coming
when it
in
comes to
and out.
domestic financing, we need to push for it. Thank you.
Okay. Thank you, Austin. You keep coming in and out. I don't know if it's only me who's having that problem. Evelyn, could you please go ahead?
Yeah, thank you. I want to make a comment about the advocacies that we listed, and I want to talk about the innovativeness. I think say that doing the same thing over and over and expecting different results was his definition of madness. And I'm not saying I'm just saying that if we continue doing the same things that we have been doing, then we should expect the same results. My point is, I think we need to be innovative, think outside the box. What is it that we can do differently so that we make progress? And I will just come up with one proposal. One, the Motsetro approach. And I want to share the experience of COVID. Right now, everybody is talking about schools opening or not opening. As in, we have already started seeing the impact of COVID on other sectors. And I think this is something I feel like we have failed in TB, that we have boxed TB in just the medical environment or medical circles, and not looked at how TB impacts on other sectors and let those sectors take the lead in that. And I'm a member of the CSTF, and one of our priorities is the multi-sectoral approach. And I feel in moving forward, one thing that we need to really emphasize on is bringing on board those other sectors. And I put a comment yesterday and said, we keep talking to ourselves. If we look at the composition we have now, you know, we are TB advocates, we already converted. I would really look forward to having another session like this where the participants, 80% of the participants will be from different sectors, Ministry of Education, Transport, Immigration, whatever, because they're going to come and add their different, even if it's just an extra effort, it's going to bring a new effort, new blood, and new resources. And that will also add into that of domestic resource mobilization. If, for example, the Ministry of Education took responsibility of TB in their sector, just 1 minute.
I see Rosemary, Olive and Rosemary hands up so that we can actually move into the next section.
Okay.
Let me just finish this.
And I see
Yeah. Okay, Evelyn, can you sum
just
up
1 second?
Yeah.
Yes. So saying if the Ministry of Education, for example, would take responsibility and agree to fund that component of the response, then that would be additional resources without necessarily going to the finance, to the national government for more resources. Thank you.
Thank you, Evelyn. Olive?
Thank you so much, Tawa. I just wanted to, this session was quite a key session because it's around knowing our representatives. And I wanted to just reflect on why should we know our representatives. And I think it's unfortunate that most of them are not on, but it's very key. One is because as communities, TB affected communities and civil society, it's always good for us to be able to document our experiences. This can be through community-led monitoring. This can also be through country priority charters or regional charters on the key experiences, the needs that we have, and then share this with our representatives so that therefore is a basis for them when they are on those decision-making tables, they're able to utilize that information for decision-making. But also secondly, it's also good for us to be able to know what is happening at the global level so that we are not left behind. Any information, any documents, any policies, any strategies that are being developed from up there. How we know those communication materials, we know them and we are able to engage because we have the knowledge and the systems and the structures within our processes. But then the last thing I also wanted us to talk about is in terms of monitoring the implementation of the commitments declaration, because sometimes if you don't know something that is happening at global level, even at grassroots level, it becomes hard for someone to take someone accountable. So it is very key for us to know who our representatives are and how they are also informing strategies, programming at those levels. Even at country level, do we know our CCM, country coordinating mechanisms, at our own level? Do we know our country level Stop TB partnerships? Are we engaging with them? So that is one key element I just wanted to say within this session. Thanks.
Thank you very much, Olive. Rosemary?
Thank you so much.
I'm going to give you a minute and a half.
All right, so my contribution also was about this conversation around representatives, just looking at how important governance is and civil society and community engagement is in governance spaces, whether it's national, regional, or global. And I think one of the areas we can do better is around the feedback and consultation mechanism. And I know just out of my own experience sitting in global or regional governance spaces, I know the issue around consultation and feedback can be a tricky one, especially where you have board meetings where materials are confidential until during the board. Sometimes you do not know when the meetings are going to happen until they happen. But I think we can figure out how to go around that by, I think, having this slotted in our maybe quarterly calls or monthly calls, where we can bring our representatives on board and where we can hear what is happening and how we can feed into that. So just looking at how can we consult our constituencies, communities, and people interested in the work that we do, either ahead of the board meetings when that is possible, when we know and when we know the agenda, or even coming back to perhaps share a summary of the conversation. I've seen quite a number of civil society delegations or community delegations do a communique after the board meeting, which usually is very helpful. So I think that's also something that perhaps we can look into. I just wanted to share those reflections. Thank you.
Thank you very much. I think Olive and Rosemary shared something that is important, that we do need to know our representatives. And hopefully we'll take, can this be an action item to see if there's a way that this can be communicated?
We need to end this section.
Hello? Hello? Hello?
Let's take the last question from Rhoda, I think, so that we can edit this section, Chawa, so that we can go on to the
Okay.
Yeah, thank you. Thank you very much, Chair, and congratulations, Austin and team, for the great initiative. We are on board together. Mine is more of an observation rather than a question. In terms of how can we optimize resilient and sustainable systems when it comes to TB? As a consultant and also as a TB survivor, I find I don't know, I can't get the right words, but I find an imbalance when it comes to resilient and sustainable systems for health. In many countries, for example, you'll find that the PLHIV network, they get institutional support, and a lot of the interventions related to RSSH are actually designed from a PLHIV perspective. But when it comes to supporting TB networks, even with institutional organizational support as defined in the RSSS package, or even with community interventions for TB, you find there's very little thought process. You even find that in some CCMs, they don't have a TB person living or affected by TB representative. You know, so there's really work to make sure that when we are talking about diseases, we don't generalize from PLHIV in order to actually advance and have more effectiveness in terms of meeting the TB targets. Thank you.
Well, thank you very much. I hope those points are all taken into note, and we'll end this session. Thank you. It's right on time. Thank you very much.
Thank you, Chawa. I think we need to move quickly now to the next section. Sorry, James. The section is on just a consultation on the TB high-level meeting and shadow UNSG report that is being prepared. This is coming from the civil society. You remember at our last board meeting in Jakarta, we agreed that we're going to have a qualitative report coming in back-to-back, coming from the UN Secretary General. We know that usually when the report comes from WHO, it's mainly quantitative numbers without looking at the quality of care that our people do receive. And we are speaking about person-centered approach to TB, which is being recommended from the high-level meeting. So, on that note, I'm going to invite James Marler from Property Partnership just to give us a little bit introduction and also talk through the process. We have the lead writer, Sarah Middleton. She's not able to join us. I'm sure you have must have seen her on the agenda. We also have our regional focal person from Africa, Olive. She is online. support it. But in the meantime, let me just invite James Mala to just take us through the introduction. James, please jump in. Thank you.
Thanks so much, Austin, for the opportunity to discuss a little bit today around the UN high-level meeting and follow-up accountability and a process that's underway, led by Austin and the other Stop TB board members and delegations to try to produce a community perspectives report looking at progress in terms of UN high-level meeting targets and commitments, and also priorities from the community perspective going forward. I believe in Tandi's presentation that you saw yesterday, she talked a little bit to the UNSG report, which is the formal report produced by WHO for the UNSG, looking at this progress. Now, this report is something that's complementary. It's produced by civil society and communities, and it is very much meant to be, trying to, I guess, shape up a little bit of an advocacy agenda to shift things in the TB response that are priorities. I note that similar reports have been produced in the past for HIV, among other areas, but this is a first for TB, and I think it's an exciting opportunity to produce some ambitious recommendations that can be really driven and taken forward by TB-affected communities and civil society at the country level. So I'll be very quick on what I was going to talk to, and then hand over to Olive, who can talk much more extensively around the content of the draft report and where it currently sits. But just so everyone, just to make sure everyone is on the same page. In 2018, there was a high-level meeting on TB. A political declaration emerged from that meeting that all countries agreed to. It contains a number of targets and commitments which those same countries need to achieve, and as a global TB community, we need to achieve. There is some specific targets in there which look at a number of people affected by TB and preventative therapy and this sort of thing. But there are also a lot of commitments that look at issues of community rights and gender, among other things. So I just want to just flag some of those with you right now, so that then when Olive shares her reflections, you have that context and foundation. So the UN high-level meeting global targets, and you can see them on the screen. There's, I think, 5 key ones. There are more there, but just to really focus on these 5. The first, including 3.5 million children, including 115,000 children in regards to DRTB. The third is on preventative therapy and preventative treatment, and making sure it's received by 30 million, including 4 million children and 6 million PLHIV. The fourth is around financing, and it's the $13 billion figure that's needed for the TB response, which is more or less a doubling of current levels of investment, which is really interesting, linked to that 33% campaign that Austin talked to just moments before. And the fifth is around investments in R&D and getting that to a level of 2 billion annually. And there is some interesting campaigns done by groups like the Treatment Action Group, who have looked at what percentage countries should be investing in their national research and development budgets in TB in order to reach this target. And it's actually quite a small percentage. There's some links just below here on this slide, and you can see the full declaration is in the first one, should you want to have a little bit more information. The second link I've provided is a summary of targets and commitments. And the third one is a country dashboard that you can see in terms of progress that's been to date around some of these targets and commitments. And so you can type in your country name and see where your country sits in relation to those sorts of things. So in terms of at the country level, I note that obviously having these global targets is critical, but unless they're translated down to the country level, they're very difficult to sort of monitor and for there to be effective accountability mechanisms in place. So for those 5 targets that you saw on the previous page, you can see that Stop TB has done some modeling to develop national level targets. And in the link I've provided there, you can go target by target and see what your country level targets are, which is a really useful monitoring and accountability resource. This is an example of the sort of thing that you can see there in terms of the country country, what its levels are and what it needs to get to. Finally, before I hand over to Olive, it's just to, as I mentioned, it's not just the targets, but the commitments that are critical, particularly I think for a lot of the community perspectives. And I note that there's a lot of commitments that involve meaningful engagement of people affected by TB, the special attention to those who are most vulnerable, and which includes TB key and vulnerable populations, the need for nutritional and socioeconomic and psychosocial support, addressing legal barriers and socioeconomic and cultural barriers. And there's a specific one calling for the end of stigma and all forms of discrimination. There's a call for TB programs to be sort of governed by principles of equity and ethics and gender equality and human rights. And finally, there's a commitment around accountability and global leadership that is multi-sectoral, which at its heart requires TB-affected communities and civil society to be a key part of that. So I'm going to hand over to Olive, or back to Austin and over to Olive. Thank you.
Thank you so much, James. I think Austin is quiet, so meaning that I can take it on. Unfortunately, I can't switch on my video. My network is not that good. Just to say that this report has been produced by the TB-affected communities and the NGO delegations to the Stop TB Partnership. It's something that we started in the couple of, I think, the last 2-3 months ago. It also aims to complement in terms of the progress report on the political declaration that was produced by the UN Secretary General, which James, you've alluded to. And it also looks at progress and challenges in implementing the declaration. The community's report is a result of a range of participatory methodologies. I would like to thank a couple of people that are on this call for participating in one way or the other, giving information, evidence, documentation, and even case studies. And this, in terms of what we had 4 regional focal points, and I am the focal point for Africa. And what we did is we conducted interviews and we gathered evidence through documentation or case studies. And also we conducted interviews and then with key global stakeholders to get specific technical areas. And that information from the 4 regions was collated and put together by Sarah, who unfortunately is not part of the call today because of some clashes in her timetable, in her schedule. However, I just wanted to quickly just talk around the structure of the report. We have 6 key areas. One is around reaching all people through TB diagnosis, treatment, care and prevention. The second area is around making TB responses rights-based, equitable and stigma-free with communities at the center. And then the third action area is accelerating the development of essential new tools to end TB. The fourth area is investing in the funds necessary to end TB. I think we've been talking about that. And a lot of congratulations, Austin, for TB 33%. The other area is, that's the fifth area, is committing to accountability, multi-sectorality, and leadership on TB. And then the sixth area is leveraging COVID-19 as a strategic opportunity to end TB. Recognizing that COVID has come with its own consequences, but looking at it as an opportunity. In terms of overarching messages, we have threefold. One is, first of all, the 2018 high-level meeting and political declaration served to profile TB like never before. And I think we all knew that that was the very first time that we had a UN commitment and where leaders came together to talk about TB specifically. And most of it is to come up with global commitments, set targets. However, 2020, I think 2 years on, we've seen that there's been a major gap between the global targets which were set and the achievements that have been realized so far. And this has caused what we're calling a deadly divide. And it has been, because of this, the deaths have increased and the suffering has also increased. And this is mainly because of how COVID has exacerbated the effect and the threat and has increased threats to TB. And actually, even the response to it has, COVID has become a significant threat to the TB response. I want us to quickly discuss in terms of what are the key recommendations as a result of this, the shadow report. First of all, the shadow report, we are calling it, we're titling it, a deadly divide between the global commitments and the community realities for TB. Actually, that's the call to action. So within we have 10 recommendations, and the call to action has 10 key points. And this is talking around closing the deadly divide between what the commitments were and the realities for TB. Within that, we have the very first is the promotion of human rights principles. This as non-negotiable foundations for all responses to TB at all levels. This talks about gender, equality, privacy, confidentiality, participation, and benefit from scientific advancement. The second recommendation is to hold a United Nations high-level meeting on TB exclusively in 2023. And this should be attended by heads of states with and in the leadership of the affected communities and civil society hearing in advance. And we are also talking around implementing an independent, transparent, and high quality multi-sectoral accountability framework that meaningfully engages communities and other sectors. And the fourth point within our recommendation is to develop and fund and implement a TB COVID catch-up plan to enable national TB programs to get back on track. Someone yesterday talked about it. I think that was Eliud, Dr. Eliud Wandwalo from Global Fund. I think this is a key thing that we need. A plan that enables national TB programs to get back on track and accelerate progress towards 2022 commitments of the political declaration of the fight against tuberculosis. And then our recommendation number 5 is to set clear, transparent, and locked in national targets for the commitments in the political declaration on the fight against tuberculosis and implement action plans to achieve them. We have various strategic points on that, including M&E funding, also including national strategic plans, moving away from generic and must tailor and adapt interventions. And what is key is we all are now knowing that our countries are doing CRG assessments. How do we get that information into our national strategic plan so that we're not just having these generalized strategic plans or operational plans that we're calling them, but those that respond to the needs of the TB key affected communities, key and vulnerable populations. The sixth point is to invest now in TB research and development for new tools, including the development of an affordable and accessible TB vaccine and related capacities. We know that R&D, especially when it comes to TB vaccine, has been lacking, and we've been talking about it. Now is the time that we need to also think and get our leaders to invest on TB R&D. The seventh point is to seize the use of all outdated, including smear microscopy, harmful TB diagnostics and drugs. We all know that after effects of TB medication, what is the role of our leaders in terms of ensuring that these outdated and harmful diagnostics and drugs are replaced by new modernized treatments. The eighth point is to conduct the integrated community rights and gender assessment and TB stigma assessments to quantify and qualify the key barriers to TB services, including with the attention to the rights and legal context, gender equality, and stigma and discrimination. These assessments are what is really needed on the ground. I think I talked to the national strategic plans that no longer is this a time for generalized national strategic plans, but strategic plans that respond to the needs according to the country contexts. The ninth one is strengthen and modify TB monitoring systems from community-led to the national level to provide real-time and disaggregated data on the scale, impact, and gaps in TB services, and particularly for TB key and vulnerable populations. I will talk on the last point, which is the 10th call on our action plan, which is to collaborate to achieve 100% of the target for financial investment in TB. And that is why I'm really, really excited about the TB 33%, the SCORE TB campaign. We need funding, both internationally, but also from resource mobilization, increased domestic resource mobilization. So those are the 10 recommended areas. In terms of way forward, in terms of what we are now doing is we are sharing this report, and we are welcoming feedback on key issues that you think that should be highlighted in the report, especially when it comes to the recommendations. If there's something that you think that we have left out that needs to be highlighted, please let us know. It can be through using the chat right now, or it can be an email to even Chief Austin, myself. You please give us more information, any data, any evidence that you have, any case studies that you think that has not come out through these key recommendations. What I also wanted to know is once the report is finalized, we will share, we will disseminate it with you, but it also be good if you can disseminate the findings and advocate for the recommendations, and particularly amongst our governments, Africa Union, our regional economic commissions, and those of us who sit in various platforms, and then also with the other UN member states. With that, can I hand over back to Austin for way forward? Thank you.
Thank you, James. Thank you, Olive, Afro Global Alliance is actually hosting the platform for this UNH high-level meeting target reports against the UNHG reports. We'll be sharing, the reason why we had to do this consultation is also, first of all, to make sure that countries are aware of what is happening. We know that our regional focal person Olive, have reached out to you during the consultation with the questionnaire that we developed to make sure that we get input from everybody, making sure that we leave nobody behind. So on that note, we needed to also come back to you just to inform you where we are. You are aware that we'll be launching this report at the Stop TB Partnership Board meeting in Nigeria, which will be from the 17th to 20th, but to be specific, we're launching the report on the 18th November 2020. And there's a call to action that to support advocacy around the report. And when this report is launched, we expect countries to support the dissemination of the report, and also the call to action, sending there will be letter writing to parliamentarians, to your executives in terms of the political leaders. Let me invite James Mala also to speak a little bit on this, because we're doing this, we're getting support from the Stop TB Partnership as well. Hello, James.
Thanks, Austin. Just very quickly to add what you've said to what you've said. I think there's in the Stop TB board meeting, I think that they'll be using this as a platform for discussion and endorsement by all of the partners who are there. And so that's going to be an agenda item within the board meeting itself to supplement that sort of formal discussion with partners. There's been the discussion to maybe do in the week of the 24th of November, maybe some regional level launches that will sort of engage regional level stakeholders, whether it be those linked to the Stop TB partnerships and all of those in this meeting, among others, to try to sort of generate as much noise around the report as possible. I think that this report is all good and well, and I think that I note that the draft recommendations that Olive shared are a really good starting point for discussions, but it's really about what people do next. There will be efforts to translate the report and the recommendations and the call to action into French, Spanish, and Russian, at least at a starting point. And I note the French for our draft TB colleagues who are on the call. But there will be, I think we're going to develop a supporting package to help country level partners to sort of conduct some advocacy around this. And so there's, I guess, 5 steps that I put up on the screen here that would be really good from each of you and your networks. And the first is, once it's released, to read the recommendations and share with your networks. And also, I guess, something even before this, based on Olive's comments, that if you have further inputs that you would like to provide, please reach out to Olive and Austin to do so. The second area is around engage. There'll be a social media campaign developed, so please engage in that campaign to sort of share the messages that are priorities that come out of that. The third, we'll draft a template letter so that you can write to your ministers of health and heads of state, and we would love if you can sort of tailor that to each of your country contexts. The fourth is reach out to your contacts in the media to get journalists briefed. And we'll also provide you with a template for an op-ed so that you can hopefully get something published locally as well, talking to the priorities. And the fifth is something for you to all consider. Maybe it's for either December or early in the new year, to see if you can arrange a national roundtable to really unpack the community perspectives and to develop a response nationally to those recommendations. So thanks for the opportunity for adding that, Austin, Olive, and everyone here. Thank you. Back to you, Austin.
Thank you, James. Thank you so much for that comprehensive brief about our next step. This is good. We intend to end before lunch, so that we end for today before lunch. I know that yesterday was so dramatic and historic for us because I have never sat since the COVID outbreak that we started doing most of our virtual meetings. I have never sat in a meeting for over 7 hours, still seeing people seated, wonderful participants that we have here. We'll be going to the next section, which is about our next step. Yeah, so I will invite Dr. Timothy Ike, who is a technical officer for the Bridge Health Nigeria. So Dr. Timothy, if you can take over the floor.
Thank you, Chief Austin. Good day to all participants. I hope you can hear me, sir. Good day, all participants. My name is Dr. Timothy Ike. Okay, my name is Dr. Timothy Ike from DHDC in Nigeria. I'm going to be taking us through the next session, which is going to be focused on the development of the work plan for the region. We're going to have panelists, participants who would have an opportunity to speak directly into what's the next region, what the network support for civil societies and community groups during the grant implementation process and monitoring will be doing. And for this session, we're going to have 4 speakers. We're going to have Sansan, Endal Kachu, Rogero, and Paul Kamugasha. So I'd like to call on Sansan. Sansan, if you're with us, I'd like to call on you right now to, speak for the next 3 minutes on your inputs into the work plan for the region. Sansan, over to you.
Hello. Hello.
Yes, Sansan, you have the floor now, please.
Yeah. Can you?
Hello, Sansan.
Work plan with
I don't know, participants. I don't know if we can hear Sansan. I cannot hear him.
I can't hear him either.
Okay, great. So maybe Sansan.
No, we are not hearing him. Also.
I think
right.
Samsung's network is really bad.
Austin.
We can invite Andy from Ethiopia to start up if Samsung.
Yeah, I'm here. Austin. Hello.
Dr. Timothy. Okay, I think.
Okay, Sansan, you can go on, Sansan. Your network seems to be better now.
Okay. What I say, I need the.
We can invite Andy from Ethiopia to speak before.
Can you share with me the work plan on the screen that can permit me to have an overview of the work plan to do my inputs, please?
Okay. Thank you very much. This is Indy from Ethiopia. So first, I would like to, congratulate, and I would like to be grateful about this event. It is really a new and a big platform for African civil society, which can really fuel up our advocacy engagement as a country and as a continent. So I'm going to list, I'm going to share some of our, next step, not as a country, but also as ACT, as a regional network. We will continue to build and strengthen our network at the region and at the country level. And also we will map all those relevant, more specifically relevant civil society and community-based organization in each country and at the region level. So, and also we will develop a kind of advocacy platform such like this one, so that everybody can share experience, everybody can get empowered, and we will have a chance to share a lot of information and experience between patient survivors and community. So this is the third next step from the ACT side. And also we will develop a work plan more specific to the regional priorities. I mean, the related to the advocacy, the one which was already mentioned, which was the video. It was really inspiring and it was really good. So we will have those kind of plan, and we will have those kind of strategic direction on the next step. And also we will develop and disseminate the community right and gender tool at the regional level. And also we will have a chance to, just like the one which was mentioned from the Global Fund colleague about the platform, about the in order to maximize, in order to increase our voice at the region and at the global level, and also we will mobilize more resources for the community. It was when Evelyn presented some of those key issues. We just mentioned that as a community, we had to be meaningfully engaged, and the issue related to missed case finding, social protection, accountability issues, domestic financing, and also the community-based monitoring, and also the way how can we address stigma and discrimination, also our key priorities. This is it. Maybe we do have actually a lot of way forward. We are planning those strategic direction. I hope if you have those kind of information, I mean, inputs, we are happy to get those comments and suggestions. And thank you very much for your time.
Thank you very much.
Hello, Austin. Hello, Austin.
Sansan, are you back?
Yeah, I'm back.
Please address the chair, not me. Okay, thank you.
All right then, Sansan. Yes, I'm the chair of this session. My name is Dr. Timothy again. Let me reintroduce myself. Yes.
Yeah.
So I'll give you the next 3 minutes to give us your own inputs, and then we move ahead. Thank you. Over.
Okay, thank you. Okay. Can I speak in French? Because we are francophone. If it's possible.
Go ahead. Speak in French.
Okay.
It's fine.
Ok, merci à tous, bonjour à tous, d'avoir permis vraiment à tout le monde d'être sur cette plateforme-là. Et nous, francophones, nous sommes très heureux de participer à cette plateforme parce que depuis un certain temps, nous avons été mis en marge de tout ce qui est dynamique au niveau international, donc par rapport à la barrière des langues. Donc aujourd'hui, nous remercions Austin d'avoir permis d'avoir cette plateforme-là avec Bertrand Campour, le président. Donc moi, en tant que responsable plaidoyer de DraftTB, je vais décliner quelques actions que nous allons mettre en œuvre en 2020 et même en 2021. D'abord, la première des choses que nous allons faire, dans ces premiers jours, nous sommes en train d'évaluer les engagements des Nations Unies avec l'outil Multisectoral Assessment Framework que nous utilisons, le MAF, avec l'appui du Stop TB Partnership. Donc, c'est urgent pour nous de pouvoir voir dans 12 pays francophones, voir comment est-ce que nous avançons vers le progrès de UNHLM. Donc, ça a commencé, les gens ont été formés déjà. Donc, d'ici fin de ce mois, nous aurons les résultats que nous allons publier au niveau des pays francophones qui font partie de cet assessment-là et au niveau aussi des pays africains pour que tous sachent un peu ce qui est fait au niveau francophone. La deuxième des choses que nous avons comme urgent à faire actuellement, c'est de renforcer les capacités des survivants de la tuberculose et de la société civile. Et quand on sait que l'un des gros défis en Afrique francophone, c'est le renforcement des capacités. Donc, la capacité des organisations à porter les plaidoyers, à pouvoir influer sur les engagements pris au niveau des pays est un vrai défi. Donc, il faut pouvoir les renforcer, leur donner les capacités qu'il faut pour qu'ils puissent porter les voix. Et associer à ce niveau-là les parlementaires. Et je dis merci à Déborah, qui est en ligne ici, pour l'action concertée qu'elle fait avec DraftTB, pour permettre dans ces différents pays, les parlementaires de participer à ce lot plaidoyer que nous faisons. Donc, après les résultats de, comment on appelle ça, de la redevabilité que nous allons faire, l'accountability framework que nous allons faire actuellement dans les 12 pays, nous allons les utiliser et les parlementaires vont faire des vidéos avec les responsables des programmes sous la supervision de One et CanTB, que je tiens à remercier aussi avec l'Union. Ils vont nous aider à ce que nous puissions avoir des vidéos et des messages poignants pour pouvoir toucher les décideurs au niveau des pays, donc les présidents des républiques, les ministères de la santé des différents pays qui ont pris des engagements à l'ONU en 2018 et pour leur dire là où nous sommes avec les engagements qu'ils ont pris. Ça, c'est vraiment un point important que nous sommes en train de mettre en œuvre au niveau des pays francophones et poursuivre le renforcement des capacités avec le partenariat que nous avons avec ACT et les autres réseaux ENASCO et autres de la sous-région pour être appuyés, pour aider ces pays francophones avec l'expérience que nous allons voir dans les pays anglophones et les expériences que nos ONG locales ont. On va essayer de documenter toutes ces bonnes pratiques qui sont faites et partager aux autres pays pour que les autres pays puissent savoir qu'est-ce qui se déroule dans d'autres pays et comment les autres pays apportent leur expérience. D'autres choses que nous allons faire aussi en termes de plan d'action, c'est d'impliquer les célébrités. Alors, la dynamique a été commencée déjà dans 2 pays. Il y a la RDC, et la Côte d'Ivoire qui ont engagé des célébrités, comme le disait Martin Lutti Kadouti, les célébrités, les leaders religieux, les médias, pour qu'ils accompagnent toute cette dynamique au niveau des pays francophones. Donc, signer des partenariats avec eux pour qu'ils portent leur voix afin que la lutte contre la tuberculose soit entendue dans ces différents pays-là. Et le dernier point, c'est vraiment d'engager ces suivants dans les pays pour mettre en place le réseau des personnes qui ont été infectées et affectées par la tuberculose, pour qu'ils puissent continuer la lutte, aider les pays à ce que les pays puissent vraiment avoir ceux qui vont porter des voix et que les interventions que nous ayons soient sensibles. Le dernier point que je voulais ajouter, pardonnez-moi, excusez-moi, c'est le CSJ Assessment. Actuellement, il y a 3 pays qui ont déjà fait le CSJ Assessment au niveau de l'Afrique francophone. Vous avez le Cameroun, le Niger et le Bénin qui ont déjà fait le CSJ Assessment, et ce qui est un exploit pour les pays francophones parce que depuis, rien n'a été réussi à ce niveau-là. Mais je pense qu'avec Draft TV, il y a 3 pays qui ont déjà fait. Il y a la Côte d'Ivoire qui vient bientôt avec son CSJ Assessment, et nous comptons étendre le CSJ Assessment dans tous les différents pays pour que nous puissions avoir des plans d'action et des actions sensibles aux droits humains, aux gens et aux populations clés. Donc ça, c'est vraiment un cri de cœur que je lance ici avec tous les pays qui sont en ligne francophones, avec les représentants de l'Union, des parlementaires de WAN et CAN TB et même de ACT TB, d'accompagner cette dynamique en termes de CSJ Assessment pour que dans ces pays, nous puissions avoir les défis en termes de droits humains et des barrières pour pouvoir lever toutes les barrières pour permettre aux patients tuberculeux de prendre leur traitement et de pouvoir guérir et de venir pour qu'on puisse atteindre les objectifs de UNHLM dans les pays francophones. En tout cas, voici les grands plans, les grands points que nous voulons faire dans ces 2 dernières années pour espérer vraiment influencer sur la tendance des engagements des Nations Unies que tous les pays francophones ont pris. En tout cas, merci beaucoup à Austin, merci à Stop TB, merci à tout le monde pour vraiment l'importance que vous avez accordée à Draft TB pour participer à cette formation-là. Merci beaucoup et ciao, ciao. Thank you very much, everybody, for this action today. I'm very, very happy, and I greet Stop TB, Global Funds, ACT, and other partners online. Bye-bye, thank you. We are together, and we think that we will be better today. Merci beaucoup. Allô? Allô?
Kambula, pourquoi tu portes England là?
Much. Merci, Sansan, and thank you very much for your contribution to the discussion. Lastly, we're going to take the inputs from Paul Kamugasha. I don't know if he's on.
Paul, you can continue, Paul.
Paul, the chair is inviting you to speak. I'm not sure whether you can hear.
Yes, Paul, please, you have the floor now.
Thank you very much. Like I said before in my presentation, I'm grateful to be part of this. I would like to congratulate Chief Austin Obiefuna for the great job he has done. Like starting yesterday, having 7 hours of presentation, it was not an easy task. As you may all know, the cross-cutting aspect is about meaningful engagement of civil society and communities. And this aspect, of course, ACT has a roadmap, which you think the priorities of that roadmap. I want to paraphrase, to mention a few of the things because of time. I think the most important aspect here is going to be to look to continue to build and strengthen the capacity of national civil society organizations and community TB networks in Africa. As you know, we need meaningful engagement, means actually engaging. Then we need to mapping and maybe profiling of TB networks, regional and national, at both regional and national levels. Then provide a sustainable advocacy platform for TB, civil society, and communities in Africa. As we know, the Global Fund has the community system strengthening that emphasized community advocacy platforms, but since it started, it has never been prioritized. It's time to have advocacy at the grassroots in form of community advocacy platforms, and as well as the Engage TB model, so that we are able to start advocacy from the grassroots. Then we're supposed to develop regional and support national advocacy priority as well, whereby we make sure we give out members of parliament. Then develop and disseminate a CRG tool compendium, source of very priority. Then continue to represent the voices of the CSO and communities, which is a cross-cutting aspect, and I keep talking about it. Then advocate for more resources for TB. Advocating for more resources needs involving policymakers, members of parliament. It's very important to work with them and develop that kind of cascade. So the next priority is we look at also to ensure to provide specific input to form the regional networks on areas that are very, very comprehensive. There's the area of equitable access that looks at integration of malaria, AIDS, and TB. We need a comprehensive, equitable access outlook that can compound all these. And lastly, there's a need for double focus. I've already said double focus on TB and COVID-19. As global advocates, I can see big names here, the Austins, Mayowa, Carol, many. You know that all along we've been fighting to raise the TB profile globally. Thank God we got the first UNI meeting making TB a decision point. So now it's time to ride on the COVID-19 pandemic, make sure we integrate it with TB. That will automatically raise the profile of TB globally. So it's time to have TB more visible instead of having its services distracted. Instead, integrate and have it more visible. With those few lines, I think I can sign out by saying kudos to ACT for building collaboration this level now. This is the beginning, the sky is the limit. Thank you, Chief. Thank you, the rest of the team of ACT. Cheers.
Thank you very much, Paul, for the elaborate discussion. And thank you also to ACT for this platform. So we're quickly, I don't know if Rogerio is presently in the meeting right now.
Rogerio is not around. You can continue, Chair. Yeah.
All right, sir. So thank you. So since Rogerio is not around, that's the input we are going to listen to. But before we do, I go, I'd like to quickly. Yeah, I'd like to quickly give us the next step. Yes. What are the next steps? What are the key next steps that we are trying to look at after we disperse from this interaction? Number one, we should continue to build and strengthen the capacity of national CSOs and communities TB networks in Africa. Mapping of TB networks at the regional and at the national level is also very, very important as a next step. We should also provide a sustainable advocacy platform for TB CSOs and communities in Africa. The development of a regional support for national for advocacy priorities. That is also a next step.
Ce que j'avais demandé à Félicité d'ajouter. Le projet que vous avez écrit, vous n'avez pas mis les clés de leadership.
Okay,
Mais
so develop. We're also
elle a
supposed
créé
to
le club de
develop.
leadership comme un effet d'entraînement de ce projet-là. Mais les projets soumis n'avaient pas le club de leadership. Donc, ce sont des expériences que j'avais fait ici à Kinshasa. Et
Develop and
s'il te plaît,
disseminate the
ferme ton micro.
CRG. We should continue to represent the voices of the CSOs and communities in Africa. And lastly, as a key next step, we should continue to advocate for more resources for TB, which is actually a cross-cutting problem across most of the countries that came out today to speak on this. So thank you very much, participants. Thank you, Chief Austin, for this platform. And thank you for listening to our own session. Over. Thank you.
Thank you, Dr. Timothy, for sharing this section. Wonderful. Thank you so much. And thank you to all the participants who spoke.
Qu'est-ce qu'on peut prendre par rapport, surtout par rapport au
Thank you, Andy from Ethiopia, Roger Paul from Uganda, and Sansan from Côte d'Ivoire. This shows that teamwork is not just the work of just one person. We are all working together in the background.
Thank you, Chief
to make sure
Austin.
that we achieve this event. On that note, I really want us to close before lunch so that people can have time to do other things, because tomorrow we'll be having a training on community-led monitoring. This will be coordinated by Olive. But what I will do is that when I invite some of the key partners, regional partners that supported this event, it's not just one person. We all did it together as a team. All the participants in this event, we are all part of the planning committee. So it's not that we don't have any single person who did more or did less. Let me invite Rosemary from Waki Health, just use 1 minute to say something as we end this. I'm not sure Rosemary is well connected again. Let me invite Bertrand from Draft TB to just give us his closing remarks for this two-day event. Just use 1 minute to do it so that we don't keep the participants waiting. Yeah, thank you.
Okay, thank you, Chief. Only 1 or 2 words. So the first point is that as Africa, we show a good picture on how we can work together, not leaving someone behind. Actually, we are very happy to make sure that in Africa, we can really work together. And then my last recommendation was if ACT Secretariat can make sure that we have all the presentation in French, that because I received the request from those who are French speaking. So thank you very much for all the partners. Thank you for the wonderful opportunity. Thank you for the collaboration. Thank you for making it happen that we strengthen our collaboration and partnership. And thank you to everybody.
Thank you, Bertrand. Just to inform all the participants that we'll be sharing all the presentations that both the ones that we are not able to. So we'll be sharing. So please say, can you mute your microphone?
Thérèse, ferme ton micro, s'il te plaît.
Chief Host,
on entend tout le Congo, ça que tu dis là.
Thank you. So let me invite Inaso to give us a short closing remark, just 1 minute, that's fine. Thank you.
Thank you so much, Chief Austin. Thank you for this opportunity and also for all the participants who have been on this call for the last 2 days. We look forward to more interactions, engagement, especially as we move towards advocacy and ensuring that we put TB on the agenda. As you've mentioned, tomorrow we'll still be continuing with community-led monitoring. We'll be having Keith, the CRG department from the Global Fund, taking us through community system strengthening and then defining community-led monitoring. We'll be given examples from DRC and Tanzania. So please log in. Thank you so much, Chief Austin, and thanks for the team that has been supporting you. My appreciation.
Thank you, Olive. Let me also use the opportunity to thank all the participants once again. Tomorrow, we are, like you heard, Olive, we are having a training for the community-led monitoring. As we also use the opportunity to touch on the CRG integrated assessment. So I wish that we wanted to invite a few countries, but we're inviting all of you to be part of it. We want everyone to learn from this experience and also see how your country can actually benefit from these evidence-based interventions. So at this juncture, I'm going to just say that we thank you for staying on. I still look at the attendance for the participants. People are still fired enough with strong energy to remain. Tomorrow we are starting at 9 a.m. GMT. I'm going to share further information on the tomorrow training. We have an agenda already that I'm going to share. We have Kiva Smith from the Stop TB Partnership and Kate from the Global Fund joining. That will be led by Olive. We'll be having also experiences from countries like DRC and Tanzania as well. So make sure you make that time because it's just for 3 hours. We start at 9 a.m. GMT till 12 noon so that we don't sit in between your lunch. Wow, what a wonderful 2 days. I wish we can just continue, but we have to end it here so that we go and practice what we have actually what we've learned from these 2 days. We'll be sharing the presentations and I'll make sure that we also have it on our website. The link for the TB33 campaign will also be shared on the website with the video, and we're also going to have other videos from you as well, participants, to be shared on the Discord TB website, which will be launched during the board meeting, the Stop TB Partnership board meeting. So on that note, I just want to say thank you to everyone. Thank you to the team. You are all honored. We are honored to have you here as participants and also as planners of this event. So thank you so much, and I hope you've gained a lot of ideas on how to move forward and making sure that we achieve the UN high-level meeting target. You heard from everyone, you heard from WHO, you heard from Global Fund that we are never on target. So what do? We need to push more. We need to do things differently to be able to achieve our UN high-level target. So, and we're also calling for another UN high-level meeting for 2023. That will be a campaign that we will see that is launched by the SCORE TB campaign as well. And we're supporting all other partners as well who are also thinking alike. So on that note, let me say thank you to everyone. Thank you. Thank you to everyone. Thank you to ASID. Thank you to Stop TB Partnership. And thank you to Global Fund. Thank you, merci beaucoup.
Thank you, Chief. Thank you, everyone.
Bye.
Thank you, Carol. Thank you,
Bye-bye. Thank you. Thank you. Thank you. Thank you. Thank you.
Bye, 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 bye.
We all love you. Thank you.
Thanks to everybody. See you tomorrow. Merci beaucoup.
Thank
Bye.
you, everyone.
Chief Austin Tan
Thank you, everyone.
and the rest of the guys. Cheers. Cheers.
Thank you, Ebwe. Thank you, Aram from TB People. Thank you, everyone. Thank you.
Bye-bye.
Thank you, Peter. Thank you.
Thank you, Monica TB, Maliza TB.
Thank you.
Mombasa. Bye-bye, Steve.
Thank you.
Thank you, Austin.
Thank you, Evelyn. Thank you so much.
Thank you. 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 Thank you.
Nigeria too. Thank you, Dr. Muna.